Yeah, I just wanted to say thank you. This was an incredible summit. I loved hearing feedback. Sorry, as you can hear my child. I loved hearing feedback from the alumni and specifically the people that you brought on board to just give their insights to the career that they chose and how it changed and how putting in the time and the effort to really work hard in your classes and then seek feedback from professors and people like-minded. It was just very informative. I'm grateful for this summit.
Well, good morning, everyone. Welcome to the Virtual Healthcare Career Summit. Our faculty is going to help us also facilitate the chat. So if you have any questions at all or any comments or any aha moments, feel free to put that on the chat. So I'll right now I'm going to give you an overview of the event, what to expect. And we put breaks in here because we understand Zoom fatigue. And hopefully you all have a really good time here in terms of having good information and practical information because we have great people coming in. So really the purpose of this event is to provide students an opportunity to learn, network, and engage with Coastline alumni, admissions reps from different programs, and professionals in the field of healthcare. So in a bit, we're going to introduce all the event organizers, our wonderful faculty who made this happen. We're going to have our special guest give a few words to our students. Thank you for joining us, Dean Neal, Dr. Rodriguez. And for those of you that are here, you have a chance for opportunity drawing. Just make sure you fill out the feedback survey down there, sponsored by our faculty. After that, we're going to do a alumni panel with some of our students actually just recently got accepted. So you'll get to hear their journeys, programs, and services that they utilize over at Coastline. And it would also be good for you to kind of see their perspective through this whole journey. Okay, so at 10 a.m., Dr. Henry will facilitate the panel for the admissions reps. So we have someone from Kaiser Permanente School of Medicine, USC, PA program, UCI Pharmacy. So for the pharmacy student earlier, she would be a good person to contact later. And for all our nurses, we have our BSN program for Cal State Fullerton. And then we have Western University. We have the DO program, a rep from there as well. So at 10:45, we're going to have Dr. Runk facilitate the expert panel session. So we have a physical therapist, dietitian, a clinical project manager, and a dentist coming in. So unfortunately, we did have a nurse and a physician assistant originally, but they couldn't make it because of their scheduling as of this week. So it's unfortunate. Okay. And then after that, the last part will be Dr. Daniel and Dr. Huerer, are going to facilitate the pre-med club and the work-based learning. And then we're going to close it out. And right now I'm going to pass it on over to Dr. Henry.
Good morning, everybody, and thank you for being here. My name's Dr. Deborah Henry. I teach anatomy and physiology at Coastline. I started the bioethics course, so I'm glad that people are taking it. Thank you, Jim, for taking it. It's a wonderful course. I was a practicing neurosurgeon for 26 years. That neurosurgery does brain, spine, and peripheral nerve surgery, so we operate all over the body. So it makes me pretty good at anatomy. So welcome, and thank you for being here. We hope you learned something.
Hey, good morning, everybody. My name is Steve Foss. I'm a full-time faculty member in the Biological Sciences Department. I am also one of the co-chairs of the department. I've been at Coastline as a full-time instructor since 2016, so we're coming up on 6 years. And before that, I worked in the biotech industry and in the medical diagnostics industry. And again, I'll be facilitating our first panel session here with our alumni. So if you have any questions during that, go ahead and put any questions in the chat box. Thanks.
Hello, I am Dr. Lisa Demchek. I am also co-chair with Steve of the biology department. I've been teaching at Coastline for 9 years now as a part-time instructor. I did my PhD in cancer biology, and before that, I also worked in industry in a lab.
All right, hello everybody. My name is Dr. Daniel Salcedo. I'm also a full-time faculty member here at Coastline in the Department of Biological Sciences and Allied Health. I teach microbiology and also physiology, and I'm also the faculty advisor for the Pre-Med Club. Thanks for being here.
Hi, my name is Ila Farhat. I am a full-time faculty at the Department of Health. This is my third year at Coastline. Before being at Coastline, I was an intensive care unit dietitian at Kaiser Permanente and a dietitian at other places too. And yeah, now I teach here full-time.
Good morning. My name is Lori Runk. I've been at Coastline since 2015. I'm the Department Chair of Health Sciences. And prior to coming here, I worked in cardiac rehab as well as a strength and conditioning coach at ASU.
Great. And hi, everyone. I'm Dr. Paulo Varquez, and I'm the Career Services Specialist and a Career Education Counselor over here at Coastline.
Well, I'll go ahead and introduce a couple of special guests that we have, and Dr. Varquez mentioned briefly. So we'll start with Dr. Tom Neal, who is the Dean at the Newport Beach campus, and he oversees many departments, including biological sciences, health, allied health. So Dr. Neal, if you'd like to give a few words.
Well, thank you and welcome everyone. As Dr. Foss said, I'm Tom Neal. It just so happens I'm the Dean at Newport Beach campus, as he said, and I cover the areas of arts, math, sciences, and special programs. I have my PhD in biomolecular chemistry, so I was a protein chemist by trade, and decided to pursue a career in teaching chemistry and biochem for 25 years, and then I moved here to California 6 years ago to work as the dean. You have a great panel with you. Dr. Varquez has put together an absolutely stunning panel. I hope that those of you who are really looking at healthcare and allied health will actually really see some other opportunities that might be of interest to you, from sports medicine to sports physical therapy to sports dietetics and dietitian and nutrition. There's just so many opportunities. Nurse practitioner, naturopathic doctors. So keep your eyes open. Those of you who are young in your careers yet, there are just so many opportunities in the healthcare field. And you might just be greatly interested in something you haven't thought about yet. So this panels will bring up many of these conversations, and I hope that you'll listen and learn. And thanks for being here. Thank you, Dr. Varquez.
Thank you very much, Dr. Neal. And our other very special guest is Coastline's president, Dr. Vince Rodriguez. Dr. Rodriguez, if you'd like to say a few words.
Thank you. First off, for all the students and participants, congratulations for being here. I think it's a great opportunity you have to hear from all the professionals that are here today. And so I think it's fantastic that you're taking that opportunity. And also, I want to thank all of the panelists and the leaders in this group. I'm in awe when I think about all of the expertise in the medical and allied health fields. I'm definitely out of my element among this group. I come more on the computer and technology side. But one of the things we've said over and over again in community colleges is that we hire people often that came from the industries for which they're teaching and that they worked in those industries. The medical field and universities, that's probably the case in this area, but in other parts of the higher education, it's not always the case. So the fact that the faculty that are here had careers in other places prior to coming here, I think brings experience that is worth listening to and hearing, and I hope that it helps you along your journey. And with that, I'm going to end with just a thank you to everyone that's here. I appreciate all you're doing, and have a great day.
Thank you very much, Dr. Rodriguez, and for being here to support us. So Dr. Varquez, should we just jump right into our panel discussion here? All right, great. So again, if anybody just joined us within the last few minutes, my name is Steve Foss. I'm one of the faculty members in the Biological Sciences and Allied Health Department. We're going to start here, and we'll take this will take us to just before 10 o'clock. We have 4 great Coastline alumni with us, and for the 4 of you who I believe are all here last time I checked, if you haven't already done so, if you go ahead and turn on your cameras, and I will start the session here. We have a handful of questions that I'm going to be asking each of you, and we'll kind of just go in round robin order, make sure everybody gets their answers in. And if anybody has any questions for our alumni panelists, please go ahead and put in the chat box, and my fellow faculty members will be checking out that chat box and letting me know if anything comes up. And if we have a few minutes kind of towards the end, I have some additional topics that we could kind of spark some discussion with. Okay, so let's go ahead and start by doing a quick introduction. So I'll kind of just call on each of you, and if you could just basically tell us your name and maybe just when you were a Coastline student, just so people kind of get that context. So Tien, if you're with us, can you go ahead and start us off?
Yes. Yeah. Hello, everyone. My name is Tien Nguyen, and I am a junior molecular cell and developmental biology at UCLA, and I graduate as Coastline in spring 2021. Yeah. I'm glad to be here to share my journey with everyone.
Thank you very much. Tien is one of my old students, and I've been in contact with her and glad to see her succeeding at my alma mater, UCLA. So I'm very proud of her for that. Next, Bryant, if you want to, again, just give us a little bit of background, your name and when you attended Coastline.
Hi, everybody. My name is Brian Durst. I'm an executive chef with about 20 years in the food service industry. I graduated Coastline last August with my CDM, so I'm a recent graduate.
Perfect. Thank you very much, Brian. And we'll go ahead and move on to Janelle, if you're with us.
Yes, hi, I'm here.
Hi, Janelle.
Hi, my name is Janelle, and I finished my nursing prereqs spring of 2021. Hi, Dr. Dan. I was a previous Dr. Dan student, so.
Very good. Thank you. And Tony, are you here?
What's going on, everybody? My name is Tony, and I was a student at Coastline. I'm actually currently a student at Coastline taking Spanish and Vietnamese courses, so I haven't graduated yet, but I'm currently a clinical research coordinator, and I was a former student of Dr. Faust, so shout out to Dr. Faust for writing my letters of recs. Appreciate it. And yeah, I'm happy to be here. Thank you.
Very good, Tony. And I think you took 2 or maybe 3 classes with me, right? I know at least a couple. So yeah, I know Tony well. Again, we've been in touch. Tony was one of my students in spring 2020 when he started, face to face, and then we went through that big transition. So I'll always remember that semester, as many of us will. All right, so our panelists, we'll go ahead and again, I'll kind of call on you, and I'll kind of mix it up, so we're not going in the same order every time. But I'm going to go ahead and ask you guys the questions, and I know you've had some time to kind of think about these questions, but we'll start with. And I know some of you got into this already, and Tien, we'll start with you, but just a little bit of a summary of what you've been doing since you finished at Coastline, from the point where you kind of left Coastline to the point where you are now, just a brief summary of what you've been doing in that time.
After I finished my study at Coastline, I transferred to UCLA and joined Dr. Ramton Platt at UCLA School of Medicine to conduct a research project about cancer immunology. Yeah.
Thank you. Brian, how about you? If you could give us kind of a rundown of what you've been up to.
Sure. So it's kind of the same thing I've been doing. I've been an executive chef for about 10 years now, but I got into healthcare. So I've just been continuing running my kitchen, but also as the CDM at my senior living healthcare facility.
Very cool. All right, Janelle.
Yeah, so I've been just gaining more practice and experience working at a hospital here in Orange County. And I've been, since I left Coastline, I got into a nursing program at APU. And so I've just been doing all the paperwork for that. And I start soon here in May, so.
Thank you. And Tony, what kind of give us the rundown of what you've done since you last took a science course here at Coastline?
Thing I've been doing is school applications, trying to make sure I have a strategic plan and an advantage, because a lot of it is rolling admissions. So whoever's in taking the pre-med route, kind of consider that when you apply for your own program. And currently I'm a clinical research coordinator. So I'm conducting studies with Pfizer, other studies that involve hypertension and insomnia. So that kind of keeps me gain experience and learn from others. And I'm also a nonprofit executive for an organization called Community Care Alliance, and that basically is a program helping to reduce health disparities in Southern California as the homelessness rate increases around this community. So the whole point, and even whether or not I have a successful cycle or right now or next cycle, I want to make sure I remain busy, remain proactive, and constantly doing things to kind of better myself and my own community to improve personally and also kind of showcase to the schools that I'm worthy, you know. So yeah.
And I would like to say that I think Tony's resume is one of the most complete and impressive resumes I've ever seen. Tony is really making sure that he's keeping busy and getting his hands into everything and helping out, volunteering. So if anybody wants some advice on how to boost that resume, Tony, sorry to put you on the spot, but I think Tony would be a good person to go to for that. Okay, so we'll go ahead and move on, and we'll go to our next question. And Brian, I'll start with you on this one. If you could just tell us which classes you took while you were at Coastline, and maybe just a little bit of information about how you felt those classes helped prepare you for, you know, your next step.
Sure. I basically had to do the whole CDM program from scratch. None of my background is in healthcare or nutrition. I had to take a couple nutrition classes. I had to take a food and management class, a food service class. So the biggest ones for me were the nutrition, as I actually have my bachelor's in political science, and then I've been in the culinary restaurant field for 20 years. So I had no nutrition background at all. So, but yeah, those, you know, the program is great. I learned a lot, and the professors, Professor Ronk and Professor Farhat, did an amazing job with the program for the CDM program.
Great, thank you. Janelle, how about a quick rundown of which classes you took here, and again, maybe just a few words about how that helped prepare you.
Yeah, so I took pretty much all my science prereqs here. I took micro, I took anatomy, I took physio, I took chem. I took I took nutrition, I think with Dr. Farhat as well. And I took a couple ethics classes. And especially my science classes, they really shaped me to retain all that knowledge and help prepare me for my nursing career. So they were really helpful.
Great, thank you. Tony, could you give us a rundown of the courses you've taken at Coastline? Sounds like you're still taking a few, but if you could just give us that quick rundown.
The courses that I've been taking include human biology, biology of aging. I took a biochemistry course with, of course, you, Dr. Falls, and ethics course, which I highly recommend, especially in the pre-health field, just because there's a lot of things that we don't really consider when, I guess, treating patients that could affect them on a person. So it was a really good, interesting course. So whoever's interested in taking that course, I recommend. If Professor Falls is still teaching it, or if any other professor is teaching it, I recommend that course very much.
Very good, thank you. And Tien, which courses did you take with us here at Coastline?
Oh yeah, at the time at Coastline, I took biochemistry, genetic, and human anatomy. All three classes provide me a strong foundation for my upper division science courses now, and especially like biochemistry helped me the most, as it provide me a foundation about how molecular processes normally occur in the human body and how the disruption of the molecular processes lead to disease. And I also have an opportunity to learn from Dr. Fao about his experience in the industry about like how the application of biochemistry can able to treat serious disease, and the experience motivated me to pursue research to develop more solution for clinical problem. Yeah.
Thank you for that. And just as take a minute here to kind of boost our biochemistry course here at Coastline. Our biochemistry course here at Coastline is a biology course, right? And a lot of other places have it as a chemistry course. So it's a much more focus on the biology side of biochemistry. For those of you that might need it as a class that want to go into healthcare, I think taking that class with us would really benefit you. We've received a lot of feedback that it's very relevant to things like the MCAT and the type of biochemistry that shows up on those type of exams. So again, just a few words there from me. So thank you, everybody. We'll move on to our next question. And Janelle, we'll go ahead and start with you on this one. Can you give us just a little bit of information on any challenges you may have faced kind of since you left Coastline to wherever you are now that might, kind of give some important information to our people here in the audience?
Any challenges I faced? I was thinking about that question, and I really don't know of any challenges. I do know that it's been a challenge because I was a part of the pre-med club here at Coastline. And so challenges that I faced were just trying to get involved at my new school and things like that. But Coastline had really helped me with like coming out of my shell and whatnot, and talking to more people and whatnot. But challenges, I didn't really have that many after Coastline, to be honest. So I don't have very much insight on that question. Sorry.
That's fine. Thank you for your honesty. Tony, do you have any insight on what challenges you may have faced between your time at Coastline and now?
I would say the biggest thing to navigate through this pre-health journey at Coastline, especially, I think Coastline is an affordable.
And if you could answer that question for us, and we'll go back to Tony in just a second.
The first challenge that I face is balancing between research and my studying, because at UCLA, the credit system is much like shorter compared to the semester system at Coastline. So I had to find another way to study and balance between the responsibility between research and my studying. The second challenge is adapting to the multicultural environment, because at UCLA it's more diverse community, and learn how to collaborate with people come from different culture. And and I think that I have because at UCLA I had to do more project and working with others, and how to present my idea in a respectful way. So it's quite a challenge. The challenge that I face after and complete my study at Coastline.
Great, thank you. And Brian, if you want to give us some info on any challenges you've had.
I guess I kind of have to echo Janelle a little bit. I haven't faced many challenges regarding to my studies and everything at Coastline. Just my challenges will be typical workplace management challenges of managing staff and managing people, and learning how to manage everybody different, because everybody likes to be managed differently. And so it's just those are my normal day-to-day challenges, but nothing specific to getting my CDM. I guess that's not entirely true. Just figuring out how I can leverage that actually and maximize it and be able to use that to further my career honestly in the quickest way possible. So I guess that would be a challenge, but other than that, I mean, nothing on a day-to-day basis.
Okay, great. Thank you. And Tony, I did see you put some information there in the chat box. I wanted to give you, and I think that's good insight that you have there. I don't know if you're in a place now where maybe your connection's a little better, if you wanted to speak to that for a minute. I appreciate your honesty with that. I think, again, as I mentioned, I think that's probably something a lot of students feel, whether they kind of verbalize it or even realize they're feeling that way, that no matter how successful they are or how well they're doing, there's something kind of in the back of their mind telling them, you're not good enough to do this. There's going to be, people better than you, and, you're not going to be able to make it. And, that's a tough thing to deal with. I totally get it. And, I see it a lot with even my best students, have that feeling. So if you feel that way, you're not alone. I think it's good to kind of accept it and realize that, everybody goes through it, and just, you push through it and realize that, you are good enough. And I think, Tony kind of verbalized that very well. We have a couple more questions here, and then we'll have some time for maybe some Q&A. These last two questions are very similar. And also, we'll take them together. We'll take the last two questions together because I think they kind of bleed into each other. And those questions are, what would be advice for somebody who's at Coastline on how they could kind of use Coastline's resources to make their time at Coastline better? And any additional advice to someone who is at Coastline who might be looking into getting into your field of study or into your profession? So we'll go back, and Tien, we'll go ahead and start with you on this one.
Yeah, I can say that like students should like use the office hour and writing email, and like do not hesitate to reach out to the professor to ask for questions, for guidance, and for clarification. Especially like after taking a quiz or exam, like you the question that you get wrong as an opportunity to learn, to identify your gap knowledge. And I found that like forming a study group is super helpful because like I can actually discuss problem, how I approach to solve the problem, and see how other students approach to solve the problem. And I also think that like join a club that interests you can help to like have the connection, like networking, and like can connect with people have the same goal. And for me, I think that earning a certificate and start to work in the field that you think you are interested while attending Coastline is a great way to gain experience, learn how people collaborate, and see if you actually like the field. Because at the beginning, I started with the pharmacy field, but I figured out after that I didn't like that working environment as much as I thought. So I switched to work at a clinical research coordinator, and I found that I love it so much. So I think that it's a good way to narrow down which field and job you actually are interested in, because the healthcare field is kind of still broad and have a lot of like joy. Yeah, this is my advice.
Thank you. Yeah, I think Ian touched on quite a few important things. The networking piece, I think it's really great. I don't know how many times, in my classes, I have students kind of do an introduction of themselves on the first day. And I don't know how many times there's been students who find out that they're sitting right next to somebody who goes to the same four-year university as them or graduated the same year as them from a university, and they were in the same department and they never knew each other because it was a school of 30,000 people. Right. And now they're sitting next to somebody in a classroom of 25 people who they graduated with, and they start a study group and they get to know each other and they find out they have the same interests. So, getting to know your classmates, and sooner rather than later, I think we'll be back in person, and that will be a little bit easier than it is now. So I think that's, a really important thing to think of. And another thing that Tien mentioned was, I think a lot of you guys maybe have your heart set on doing something, one specific thing, right? We had that introduction little icebreaker thing where everybody was saying what they wanted to do, right? But my advice would be, don't force yourself to go down that pathway if other things interest you along the way. You can always explore other things. You can come back to that pathway if when you explore other things, they don't, but if you would have asked me 10 years ago what my job was going to be, a professor at a community college wouldn't even have made the top 20 list. Okay. Yet here I am, loving my job, enjoying my time. Right. So you got to look for those opportunities and take advantage of them. And, you never know what's going to happen. Okay. Bryant, if you want to give any advice to our guests here about, again, what you can do while you're at Coastline and just general advice for everybody.
Yeah, sure. I do agree with Ian about communicating with your teachers and your professors. I think that was huge, as Professor Farrahat and Professor Runk can attest. In my just about a year, I probably exchanged emails with them and questions about the program and the procedures numerous times. I'm sure at some point they were tired of hearing from me and getting emails from me. But I was also the guinea pig with a lot of the stuff for the CDM program. So a lot of the kinks got worked out because of me. But it was huge. It allows you to build relationships and to understand, to be able to ask questions that might be a little tougher, or you're not sure. So, I think that's huge. And I was going to say the networking as well. And also working in your field are two big things. Getting to know as many people as you can in your field will expand your base knowledge, but will also give you opportunities down the line that you might, you keep in touch with somebody, even if it's on Facebook or LinkedIn or wherever it might be, that might come about. But then also you, like Thean said, you get experience. That was a huge thing for me, at least when I was in culinary school, was I was working in kitchens while I was going to culinary school. And so some of the things that I was learning in school I was doing in class, and it sped up the absorption process, right? Like I understood and it clicked on me a lot quicker, because for me, I'm a physical learner. I was an athlete growing up in sports. And so the muscle memory thing, but that helped me even more. So I was seeing it in a classroom setting, and then going back to work that night and saying, oh, I get it, like it makes sense. And so I think getting that work experience while you're in school is a two for one. And then you build a network of fellow friends and cooks. I mean, I still have cook friends and other that I've known for 15 years, that I've worked in my first kitchen with, and we're still relatively close on social media. So I think those are two big things that can help you, down the line.
Awesome. Very good info then. And something that Brian was talking about towards the beginning about, emailing your professors. I see Dr. Farhat in the chat box said we're always happy to get emails from students. And I agree with that wholeheartedly. If I didn't get emails from my students, my concern would be that, nobody's paying attention, nobody's listening, nobody's trying to understand the material. When I get questions from students, it shows me that they care about their work. They're trying to figure out maybe where the holes are. And so I agree with Dr. Farhat wholeheartedly that you're never going to bother us by emailing us and asking us for help, right? That's why we're here for, right? And we'll go ahead and go on to Janelle. Any just general advice?
Yeah, I have a lot of advice. First step is like kind of what Brian and Tien said, talk to your teachers. I think your professors are your best resource that you can use. Allow them to get to know you and get to know them. You're gonna need a whole bunch of letters of recommendation, and if all your professor can say is, oh yeah, they got an A+, and they can't speak on who you are as a person or your character, it's not going to speak volumes for that program. So that could also mean, speaking up in class, answering questions, sending emails, doing a whole bunch of stuff that you can do to get to know your teachers and your professors and everything. That's first one. The second one is get involved. I am a huge advocate for the pre-med club. I love them dearly and I miss them so very much. I was the president of the pre-med club spring of 2021. And a lot of schools want to see your volunteer not hours, but just that you volunteer. They want to see that you are a part of a community. They want to see that you're able to work as a team. And being a part of the pre-med club, whether you're just a member or you're, or you're an officer of the pre-med club, either way, it's going to look great on any applications. It's going to give you resources to talk to other like-minded med students or nursing students or whatever the case may be. That's a huge advantage and resource that some other places can't give you. Another huge resource that you should take advantage of is the Career Center. If you have an interview coming up, I highly recommend talking to Paolo and seeing if you can set up a mock interview. Especially now that interviews are on Zoom, it's so much crazier and weirder to talk to someone looking at the camera versus looking at the person on the screen, because you're not making eye contact with them. So highly recommend mock interviews, especially for someone who doesn't really talk well to people or can't really communicate well. He gives you great examples as like what you can do better, what you could do, like not talk about as much or more. It just gives you great experience for that interview when it comes around. What was the other part of the question? I forget.
Yeah, it was just kind of general. I mean, you really covered a good portion of it. It was basically what could you do to take advantage of your time at Coastline, and then just general advice. But those are all the resources that you could take. I also, if you want to work in a hospital as a nurse or PT, OT, get experience in a hospital to see if you even like it before you spend your time, your money, everything. I started in 2020 as a CNA. I got my CNA license just so I can see if I even liked being in a hospital, if I liked direct patient care before I, wasted my time and my money going into the healthcare field, finding out I didn't like it in the long run. You know what I mean? So
getting into a hospital, whether it's volunteering or working. I know they do volunteer scribes. They just follow doctors around and like just literally type what they say. So there's different ways you can get involved in hospitals. If you don't want to work, you can volunteer as well. So those are really great avenues to take. So yeah.
That is very excellent advice. A ton of good information there. I hope everybody is appreciating all that, because I think it'd be very helpful. One thing that Janelle pointed on that I was going to bring up separately, and I'm glad she did, was about getting to know your professors. Okay, a lot of you guys are going to be looking for letters of recommendation at some point. Over the last, especially more in this virtual world, I don't know how many letters of recommendation I've had to write over the last 2 years for somebody I've never even seen before. Right? Because they're in my class. All I see is the black box with their name on it. I don't hear their voice. I don't see their name. And then they ask me to write a letter of rec, and there's not much I can do besides this student got an A in the class. The end, right? I can't really talk about anything about their personality or anything. So I know it's harder in this virtual world to do that, but I have students right now. There's some here. I'll call it a couple names. I see Jim here. I saw Erica here before. They're both students who I've never seen in person, right? But I would be able to write a very strong letter of recommendation because their camera's on. I can see they're engaged. They come to office hours. They show up a few minutes before class and log on and talk to me, or they stay after class. They, and they're always writing emails. So again, kind of take that long view that, if you're going to need someone to kind of vouch for you, then that person's going to have to know you in order to actually kind of support you in your future endeavors. So, that's something to keep in mind, that as a student, getting good grades is obviously a great priority, but also kind of the networking part of that, not just student to student, but student to instructor as well. Okay. Tony, let's go ahead and finish off with you if you have any additional advice.
Yeah, I want to echo the same sentiment as the previous alumni. Speaking with the professor is important, just kind of building a rapport. I believe at Coastline, I think the professors, from my experiences, are a lot more receptive than the ones from my experience at UCI. When I would email my professors back then, it took them like maybe 2 weeks to respond. So that was not good. And that was a quarter system, and that was 10 weeks in the course. So that didn't help a lot. But at Coastline, I thought it was really nice to have professors like Dr. Foss kind of respond within 2 business days. And that was really professional. I thought that was very helpful because a lot of these were important. In addition, when it comes to any sort of application processes that the students may go through, I believe it's always important to kind of get things started early. Like, I can't stress that enough, because there's always going to be some sort of bump in the road, even though you don't expect it. There's always going to be some sort of bump in the road, and that could affect your application cycle. And, again, a lot of these schools are going through this thing as a rolling application process. So if one school has 100 seats and you apply early, it's way better than competing for 5 seats down the road. So that's always important. In addition, Coastline is really good at emailing out resources and tools and opportunities to kind of improve your resume. I recommend to kind of check your emails, check your sources, and really get involved in these programs, because they have a lot of great programs. I heard a lot about the pre-med club, and I'm sure there's other opportunities that's specific to the certain careers that you guys want. So it's always important to kind of take advantage of those opportunities.
Very good. Thank you, Tony. And thank you to everybody here. So we do have a few minutes left. I'm going to ask my fellow faculty members here. I was trying to keep up with the chat box, but it was really going, and I'm really happy to see that, but it made it a little bit hard for me to keep up with it. So was there anything that popped up in the chat box that you think we might want to discuss here for the last few minutes?
Well, I didn't see anything in the chat box, but Steve, one question that I would like to ask, because we're doing program review, is there any courses that we don't offer that you would like to see us offer?
So this could be for our panelists, or it can be for anybody to put in the chat box. because we do have the ability to offer courses that you guys need. We'd love for you to stay at Coastline for everything you need. We just need to know what you need. So if there's any, that's a great question from Dr. Henry. So if there's any advice from you guys, I do see pathophysiology. I know that's something we have discussed in the past as one. So if there's anything else, and again, you can put that in the chat box now, or at any point, or reach out to any of us, because we do have that ability to change what we're offering. Okay. Let's see. Trying to scroll back through the chat box here if there's anything else. I guess one more kind of question. So when you guys signed up, you had the ability to put in a question that you might want to have answered. So I was kind of scrolling through those this morning to see if there would be anything relevant for our panelists here. The one thing that I think maybe at least a couple of you guys could touch on would be how to prepare for the workload that's going to come with the next step in your education, whether it be like TN transferring to a four-year university or going into a graduate program, nursing school, PA school, whatever it may be. If any of you guys had any advice about how to kind of prepare for that increased workload that you're going to face, and I'll leave it open to any of the four of you who want to answer that.
Yeah, I can start. I think that it's going to be kind of shocking when it comes to that point where there's an abundance of stuff to do and prepare for. But I don't think that you're ever going to be prepared for it necessarily, and that's okay. That's part of the challenge and part of the opportunity to grow. And I think a way to kind of mitigate that is to create a good circle amongst your cohort, collaborating amongst yourself, dropping your ego, and being willing to learn from another student, whether they're older, younger, whether you think you're smarter than them or not. It's always important to kind of get people's perspectives on certain subjects, certain ideas, certain problems. So I think that's a good way to kind of mitigate that, and also just kind of take it day by day. Like, I don't know, I'm not to sound like pessimistic, but you're gonna fail. Like that's part of it. You're gonna either, whether it's not a homework assignment, a test, or a quiz, or a project, those things are gonna come up, but how you come back from it is going to define who you are as a person. So try not to be too hard on yourself. Work hard and just be kind to yourself, though, if that makes sense. That's my suggestion. Yeah.
Very, very good. Thank you. Anybody else? Brian?
I'll go. Yeah, I think a couple of things. As I've gotten into my career, I think staying organized, as I transition into new jobs or more responsibilities, I've adopted the principle of making to-do lists and staying organized that way on a daily basis. What I need to do, and I can prioritize those things, and I don't forget anything that is going to be done, because I can just take a reference at I can just take a look at my to-go box or my calendar or my to-do list and see what I need to do. I do agree with Tony a little bit, learning from your, I won't say failures, but learning from your mistakes. You are all going to make mistakes, and being able to understanding that and learning why you made those mistakes is going to be a big part of adapting to workload. And also, I'm a big believer in balance. I know that might not make a lot of sense, but take your time away. Take if you continue to just continuously work or study, in this case, you're going to burn yourself out. There are certain times when you can't, obviously. But if you get a free couple hours, just do something that you enjoy, whether it's going to the gym or going out for walks. Like, that will help your mind and your body just stay refreshed and able to handle everything that you're throwing at it. And I know that's hard to do sometimes. I have other managers in my company that I tell them that too, but you have to try and find some of that balance of being able to get away and being able to separate yourselves from your school career or your work career sometimes. Otherwise, you're never going to be successful, in my opinion. I think that's a huge part of being successful.
Yeah, so I just saw Dr. Henry put the neurobiology explanation there on failures, which again, it's important to kind of consider that stuff, is that everybody's going through the same thing, and we're all biochemically going through the same thing, and it's how you kind of emotionally handle that. And so I think Brian and Tony gave really good advice there. So we have just a minute or two left. Are there any other questions from the audience for our panelists, or anything else our panelists would like to say in these last couple minutes?
Hey, Steve, I thought something that was interesting that some people have brought up. for those of you who kind of get set and you have an idea of what you want to do, don't be afraid or intimidated by changing that or altering it. Because I mean, I put in the chat, I changed my major. I started pre-med. I ended up in cardiac rehab. Then I was a strength and conditioning coach. I ended up as a professor. But I mean, it's okay. You're never too far in to make that change because you have the rest of your life to enjoy it. And if you really enjoy what you do, it will not feel so much like a job. It will feel like something you really enjoy. So don't feel like, well, I've gotten to this point, so I have to finish it now. Make sure you love what you do, or you'll get burnout no matter how much time you take off if you don't love it. So don't be afraid to redirect, ask people. I kicked myself every time I changed my major, and I'm so glad that I did. Just a different kind of doctor at the end of it. So
right. Yeah. Thank you, Dr. Rung. That's a huge point. Maybe one of the biggest takeaways of this panel session, I'd say, to keep that in mind. I always tell people, I thought I was going to cure cancer, and now I've decided I'm just going to teach you guys how to cure cancer, and you guys can take care of that. So, you get to the same end result, just a slightly different pathway of getting there, right? So, anyway, I appreciate everybody, panelists. Thank you so much for joining us. Very helpful advice. I hope everybody really was able to absorb some of the advice that was given. We really appreciate your help in taking the time out of your busy schedules. I see, obviously people at work and wearing scrubs and everything. So we appreciate everybody coming out and helping us. So we'll go ahead and Paulo, I'll pass it to you just to make sure everybody knows kind of what's coming up here.
Yeah. So right now we're going to take our 5-minute break at 10 a.m. Dr. Henry will facilitate the competitive application panel with these folks up here. But yeah, so right now it's a 5-minute break. So feel free to stand up, stretch. And if you have any questions, feel free to ask it here in the chat or verbally. We'll be here. See you all in 4 minutes.
So I'd like to welcome our panel that is going to discuss how for you to have a competitive application. Even if you're not going into one of these fields, the information this panel is going to give you is going to help you a lot. So we have Agacia, I hope I said that right, Lanier, who is from Kaiser Permanente Medical School. Sarah oh my goodness, Diosdado. I'll just say Sarah, who's from USC. Hedy Ha, who is from UCI. Michelle Schwartz from, I got it down here too, from Fullerton, and Chris Calzada from Western. So if you all would turn on your cameras, we'll get started. And what I'd like to ask everybody that's here too, if you have a question that is not one of the ones that I have already given the panelists, if you would write it in the chat box, I will try to get to it as well. So welcome. We really appreciate you being here. Paulo, if you'll show me who's here so I know who to call on, that would be great.
Sarah Diosdado Ortiz is here.
Oh, hi, Sarah.
Hi.
Say your last name for me again.
Diosdado Ortiz.
Diosdado. All right, I got it. Diosdado. Thank you. All right, so I don't know if you can, do you mind stopping screen share, Paulo? All right, it looks like everybody's here. All right, so our first question is, and I'll start with Sarah because you're first on my list here. Please tell us about your role at your institution and how the application process works there.
Yes, of course. So I'm Sarah Diosdado Ortiz. I am the Director of Admissions for our USC Physician Assistant Program. And if you are interested in our program, our application does open up once a year, and it is typically available at the end of April, beginning May. We do use a centralized application system, which we refer to as CASPA. And so that is going to be specific to I would say probably 99% of the PA programs that are out there right now. So that would be the centralized system that is used. And then we also have a secondary application that is specific to our program. So we kind of want to know more about why you're applying to us specifically. And then our deadline date is November 1st. So it is on a rolling basis. The sooner you get your application in, the sooner we review your applications going forward. And then we have our interviews that usually take place in fall and spring.
All right. Thank you, Sarah. As faculty must say, we're so appreciated the central process, because having to write lots of letters of recommendation, it helps us a lot. Agacia, did I say that name right?
No, it's okay.
No.
My name is Agasia. We can
I
thank my
gauged
father
ya. All
for
right, I got
that.
it.
So hello,
But people can
everyone.
butcher my name, so.
It's fine. I'm with the
So-
Kaiser Permanente Bernard J. Tyson School of Medicine. We are a fairly new medical school, and we've opened in July of 2020. Actually, we are in the process of admitting our third cohort, so really new. My role at the institution or at the school is admissions counselor. So I am that person who helps you from start to finish, from asking about requirements, the application process, and then if you are invited to interview, we give you interview information. And then also if you're admitted, which would be great, then we try to get you from admission to matriculation. So that is my job. There's a lot of other things that I do. I'm also responsible for our recruitment. So everything that we do in regards to admission, information sessions or virtual office hours, we're virtual still right now. That's all me. And as far as medical are basically what you would need to be considered for admission at our school, you need to submit a primary application to AMCAS, that is the American Medical Association that you would subscribe to. You also need to submit a secondary application. That is typical of most medical schools. Once you have your primary application, you will be invited to submit a secondary application, which are just a series of essays based on items that they want you to talk about. We also require 3 to 6 letters of recommendation. And then you are required to submit your MCAT score. And then once we have your MCAT score, your primary application, you receive your secondary application and submit that, you would be considered for an interview. Our interviews are a hybrid approach, meaning that we do what we call multiple mini interviews. And then you have one traditional interview. And then that is pretty much the process.
Thank you. It brings back lots of memories for me. All right, Hetty, want to talk to us about UTI?
Yes. Hello, everyone. Thank you for inviting me on this panel. Again, it's certainly a pleasure to be here with my colleagues on this panel. Prior to my role as a PharmD Student Affairs Advisor for the School of Pharmacy and Pharmaceutical Sciences PharmD program, I was a pre-health advisor for about 14 years and working with science majors as well. So I certainly understand that feeling of how can I get my students into your program? And now I'm on the other side trying to accept students into our program. So thank you so much for having me. Our students will apply through the PharmCast centralized application service for a majority of the PharmD programs in the nation. And then thereafterwards, there is a supplemental application process through UCI Graduate Division. And we require 3 letters of recommendations. And there's no PCAT. We do have a holistic admissions review, and so we certainly are looking for not just making sure that you can demonstrate you can handle the rigors of the program of a rigorous program, but also that you're very passionate about becoming a pharmacist. And and we just our inaugural class, I'm so excited, just started this last fall, and we just closed in on our cycle for our cycle just ended on February 1st for our second cohort, so I'm very excited.
Congratulations, and I'm
you.
glad the holistic approach is becoming more and more important in the interview process. Chris from Western.
Hi, good morning, everyone. Thank you for having me on this panel today. I'm excited to be here and represent Western U. My name is Chris Calzada, and I work in the Office of Admissions. I am one of the admissions counselors, so my role is to support students through the application process from start all the way until matriculation. And so for those of you who may not be aware, Western University of Health Sciences is a graduate health professions institution. And so we offer a variety of different programs in the health professions. I specifically work with our DO program, which is our Doctor of Osteopathic Medicine program. So I'm happy to help answer any questions in regards to that program. As far as the application process goes, we do have a primary application and a secondary application. So that primary application goes through ACOMAS. just like many other DO schools. And then the secondary application is selective. So once the admissions office receives your primary application, they will then review your application and then send out those secondaries to students who they choose or the admissions committee wants for the secondary applications. And then, of course, we have an interview process as well. We do a 30-minute interview. Right now, currently, we're doing them through Zoom. In the future, they may be in person or maybe hybrid, kind of both options. We also have an MMI as well. So be prepared for that. But our requirements are very similar to what you'll see with other DO programs. We have prerequisite courses, of course, that are required. We have 2 letters of recommendation that are required. One from a physician. It can be from a DO or an MD. Of course, we do recommend or would prefer a DO. And then the second letter of recommendation would be from a instructor that you took a class with. Some applicants choose to submit more letters, but the minimum is 2. And then, of course, we do require the MCAT as well as the CASPER. MCAT would be submitted with your primary application. And then if you're selected to fill out a secondary application, that's when you would submit your CASPER score. I'm sure there's a lot more that I'm probably missing, but but again, if you have questions, let me know. And yeah, again, thank you for having me here.
All right. Thank you, Chris. And again, if you want to put questions in the chat box, we can do that. And last, we have Michelle from Cal State Fullerton.
Hi, everyone. Thank you for having me. Name's Michelle Schwartz, and I'm one of the academic advisors here in our School of Nursing at Cal State Fullerton. So I oversee a lot of our different pathways for pre-licensure and work with students all the way from the application process to graduation. So what we're looking for, like many of the others mentioned, is 2 applications. We have the Cal State application as well as a supplemental nursing application. Of course, you require prerequisites, and we also have an interview process as well that is all virtual through a system called Kira. And so the interview and then the essay, and then we make our decisions from there. Our cycle just recently closed. We'll open again in October. It's open once a year from the time of October to January between our 2 applications. Thanks.
Thank you very much, Michelle. This is so great. I know I sent out the questions, but I'm going to skip to question number 3 because we had a question in the chat earlier about whether working in an optometric center will count as work experience. So the question is, how much and what kind of job experience do I need that will help me get into the program I want? So I'll go in the same order. Sarah?
So our program doesn't have a set required amount of hours, but we do look at both clinical and volunteer experience as long as it's hands-on patient care. Optometric specialists typically we will accept. For most PA programs, they do have a criteria of having that clinical hands-on patient care experience or volunteer experience. So I would just strongly encourage that you reach out to the program that you are interested in. We are pretty lenient when it comes to hands-on clinical care. You could be a hospice, like work in hospice. You could be a medical scribe. You could do some like mentoring for like diabetic programs and stuff. So there's a lot of different opportunities. You could be a healthcare worker. So there's a lot of different things that some PA programs wouldn't accept. And so I would just definitely recommend that you kind of check out each website, see what the recommendations are. And we do have a list on our website as well that you can reference that I think it has about 40 to 50 different types of experiences.
Well, that's so helpful to have it on the website. Agasia.
Pretty much the same as what Sarah was mentioning. We do not have a specific requirement in regards to hours that could be for volunteer work or research work or medical scribing. That seems to be pretty popular. We just really want to see that you do have that experience in your application. What I will say is majority of the California medical schools did come together in regards to a response for COVID-19, and we completely understand that a lot of people had their volunteer experiences either cut or, there was completely done altogether before that. So we recognize that, and no one will be penalized for that, but we wanted to make sure that you knew that as well.
All right. Thank you very much, Ageisha. Hetty.
Hello. Pharmacy clinical experience is working in a clinical setting is not a requirement specific to UC Irvine, but as a pre-health advisor, that background in me, I certainly say it is encouraged to have some sort of experience if you can obtain it. I know that during COVID, it was difficult at times, right, to get into an environment, especially when you don't have that scope of practice and everyone was trying to protect your safety. But the reason why clinical experience can be beneficial to you is, one, it affirms your decision that this is really what I want to do, that this is an environment I can picture myself in, that not only that you can picture yourself in it, but that you can thrive. And so whether that is in the ER, you someone who can deal with making quick decisions and love the adrenaline of that stress, or whether it's an environment you don't like. And so it helps you affirm that decision. But also when you're in interview, it allows you to talk about those experiences too. So it can help. But if you don't have it, and for programs that don't require it, I would say then that's the big question is then why? Why? Out of all these wonderful careers out there, did you choose ours? What is your why? What is your passion? And there's so many other ways for a candidate to show their passion, why they're passionate about a certain profession, if they don't or did not have the opportunity to obtain clinical experience.
Thank you, Hetty. And Chris.
Yeah, so just to kind of echo off of what's been said, we don't have any minimum requirements for working experience or anything like that, and also shadowing experience. However, I really emphasize if you have the opportunity to shadow a physician, I really encourage, and for some of the same reasons that was just spoken, as far as having that experience and be able to draw on some of those experiences that you learned and apply those to your application. And when you have questions in your interview, why do you want to be a DO? Working or shadowing a DO physician, my experience, I did this, blah, 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 and I really like this, so it's really important. And so I would emphasize more in shadowing versus working. Of course, working in a healthcare setting is obviously great, and that's another great experience. Again, medical scribe is a great one, probably the most common that we see. And so there's three things really: shadowing, paid work experience, and then volunteer work. At Western U, we really like to see volunteer experience, and that can be in a healthcare setting. That's great, but it doesn't necessarily have to be. I mean, even if you're feeding the homeless or doing a service project with your church or helping youth, anything like that is really highly encouraged. So we definitely, I would say, you definitely want to get volunteer work, definitely want to get shadowing as well. Work experience, I put at the bottom of the list as far as priority, and what the admissions committee is looking at specifically for Western U. Again, that's just an added bonus. If you have the time, of course, you're studying for MCATs, right? You're doing your classes, all that. So it is very time consuming. But I would more focus on shadowing a physician. And again, it can be DO or MD. Definitely prefer DO and volunteer work. And then if you have time, work experience is also an added bonus.
That is great advice, because volunteering gives you more than just something for your application, doesn't it? It's amazing. Michelle.
Yes, so for our nursing program, just like a lot of the others, we don't require work or volunteer experience, but we highly recommend it. I just want to double down on what Hetty said, is that it really does affirm, or not for you, that nursing is the right career. We have lots of students who come in and think that nursing is like what they see on TV with Grey's Anatomy, and it's not. It's not pretty. It's not glamorous. I would go as far as say it's not fun some of the time. So a lot of our students really just think that's what it's about, or they never have to work nights. And so really getting that experience, a CNA would be what we'd recommend experience-wise. That's what we award the most points for. We also do award for volunteer experience, and it's really within any healthcare setting. I saw some questions in the chat that I could just quickly answer is that we don't look at extracurricular activities. We really only look at work and volunteer experience for these two. And we do offer as part of our curriculum, as required BSN curriculum in California, is the public health nurse certificate. So students who come through our program will take a class in public health nursing and then qualify to be a PHN, a public health nurse in the state of California. And you can definitely combine nursing with many other interests. A great website, I would say, is if you just Google Discover Nursing. It's run by Johnson & Johnson. It has over 100 specialties listed of nursing. So if you're into crime shows, you could do forensic nursing. If you really like, that adrenaline rush, you could be a flight nurse, going to accidents on the freeway through a helicopter, right? And helping right there on the freeway. So there's really any passion that you have alongside nursing, you can combine with nursing and make a career out of.
I must say that's true, isn't it? As nursing has, of all the breadth in nurse, and all the breadth in the healthcare field, I think nursing has the most opportunities from working at home, working within homes, in hospitals, in clinics, wherever you want to work. Nursing gives you, as a neurosurgeon, I can only work one place, right? But as a nurse, you can work all over.
And if you want your summers off, go to graduate school, get your credential, become a school nurse, and then you have every summer off as well. And you're off at around 3 o'clock every day.
There's so much, and we do need school nurses too, immensely. So that is great. I'm going to take a question from the chat, and feel free, my panelists, and I'm sorry, my internet's going in and out. Feel free to answer any of the questions that are directed to you in the chat box if you'd like. But I'm going to take this one about. I have to scroll up now. The question from Alana. I'm so bad with doing names here. What sets your program apart from other programs? And what do you believe your students most like about your program? Because I like that question. So what sets your program apart? What do you think special about your place? And what do students especially like about where you are? So Sarah.
Wow, that's a lot. Let me see. So we are a longer program. We're a 33-month program compared to other programs, which are normally around 27 months. What our students like about our program is that once you start the program, it's not like you have to go from start to finish. So you actually have a summer off after your first year, which a lot of our students enjoy because you could either, one, study during that time if you're struggling during your first year. It is a very rigorous program. Or two, just have time to kind of do some self-care, make sure that you're ahead of the game before you start going into your clinical rotations during your second year. We also we're ranked number 1 in our program, or for California PA programs, and we are ranked number 10 nationally for our PA program as well. And so what we really pride ourselves on with this is having a lot of our faculty be a part of these national conferences. So they're advocating for the PA profession. They're going amongst each other and are teaching, lecturing other PA faculty within the PA field and stuff. And so a lot of the work that they're doing is also contributing to the in-classroom setting. We are a 1-to-1 iPad base, so we do a lot of modules within projecting on screens and being able to do small groups and team collaboration with that. And there's just a lot of different unique opportunities you get. So we are a primary care program. So we look specifically for those that want to go into primary care. And we teach in that field as well. So even though you get all of these different specialties like surgery and internal medicine, pediatrics, and things like that, the focus of teaching is going to be through primary care. And then we also have a street medicine program, that came about, I want to say 3 years ago. And so we were able to get 2 world-renowned PA faculty to actually join us. They started up a program with USC, and they have a street medicine program now that our students are able to rotate on the streets of LA with them and be able to get to be familiar with that population and help the unhoused and unsheltered. And so there's a lot of different things that are contributed with that, alongside a Trojan Trainer program, which is like a mentor-mentee for someone who is unhoused, connects with the student and kind of just explains their journey and what they have gone, and they help them as well. So if they need, a cell phone to call to schedule a doctor's appointment or something, then they will be able to like be with that Trojan trainer and be able to help them along the way. And it's a 1-year commitment. So there's a lot of exposure if you are interested in helping the unhoused population, then this would be a great opportunity for you to be able to come and kind of be exposed to that field in that area within our program.
Thank you, Sarah. Agesha.
Oh, there's a couple of things that probably set us apart from many medical schools, but I'll hit on I guess the ones that I get the most or talk about the most. We do not have a cadaver lab, so we teach our students anatomy by using what we call our Anatomy Resource Center. Students will learn from human specimens that are in plastic form. They're called plastidents. They're pre-dissected, so they're useful for many, many years for our students. They also use virtual reality and simulation in the Anatomy Resource Center. It's pretty cool, actually. I would say another thing that makes us unique is we have longitudinal integrated clerkships, or what most people will call their clinical rotations. And because we are a part of Kaiser Permanente, our students rotate through 6 of our Kaiser Permanente medical centers. And instead of waiting until your 3rd and 4th year to go into clinical rotations, you're actually starting in your 1st year. Students usually start in week 3. Rotating through their clinical rotation. So they're really happy about getting that experience early on. I would say another thing as well-being is incorporated into our curriculum. We have a program called REACH that is pairing you with a faculty member, a Kaiser Permanente faculty member, and you have a mentor basically all 4 years throughout your entire program. And our 1st year students are required to connect with our staff psychologist at least a minimum of 3 times a year, just to kind of check in and also, get people used to the idea of, mental health, mental wellness is a good thing. And if you're going to be asking your patients to be mindful of their mental health, they need to be mentally well as well. So that is something that we've incorporated. And then last but not least, I'm saving that for last because it's a big one, free tuition. All of our students have received free tuition for the first 5 cohorts that we admit. So free tuition and healthcare. So those are some things I think that set us apart. There's plenty more, but those are probably the big ones.
There's nothing like free tuition. I want to say that, when I was in medical school, right, I was at Baylor College of Medicine. So we started clinics earlier than most at the time, but the benefits of starting your clinics early is you can integrate what you're learning with actual practice. And as you haven't noticed already, as a lot of us changed our career thoughts of what we were going into, and being exposed to it earlier helps you understand where you want to go. Because you may have thought, like me, I was going to be a researcher and ended up in totally an opposite field, a surgeon. It's nice to be able to experience those things early. Hattie.
Okay, so I have to say that free tuition, I was mind blown when the school was opening, and I was like, how can I get my students into that program? For our program, I'm very excited that we are modeled for a small cohort. It's specifically designed that way. So each class is anywhere between 40 to 60 students, and we are a 4-year program. So I would never have more than 260 students that I will be working with. And I enjoy that because as an advisor, I really value the relationships that I develop with my students. Our program, it is a mutual investment for the students and for our team. And when I say team, our faculty and staff and the student, is that we all want the student to succeed. And so therefore, there are many touch points in our program. So many that the students are not accustomed to all those touch points. Each student has a faculty advisor, and in fact, the faculty advisor will be taking them out to lunch in spring quarter just to chat again. I meet with my students on wellness checks, and it's random. I just send them an email, and because I have access to their quizzes before they even take their first midterms, I was like, oh, this is not the usual routine for the student. What is going on? And I call them to check on them and see how they are personally doing, and not because their faculty advisor is checking on them academically. And I care about that, but I care about them. So I want to talk about, are you working a lot of hours? Where's your stress level? What's your happiness level? Right now I'm coordinating a bowling night for them to meet their new cohort. So we want to make sure that they're working very hard. It's a rigorous program, and we try to find who are they connecting with in their cohort. Do they have a support system, not only outside the classroom, but also within the cohort? And those are the things that we value and we love that we're able to do because we're a small program. Also, I have to toot our horn on this on our IPEs, which is our interprofessional education. Our students learn alongside and collaboratively learning alongside other healthcare professionals. And so during their introductory pharmacy practice experiences, they are actually in case studies with other medical students and other nursing students. So they're talking to each other as if they're in a real clinical environment, getting advice, feedback, talking about how to best treat a patient. And how nice is that, to be respectful and learn to be respectful of other professions and see the value that every team player has when they're caring for patients. And so that is something that I really love about our program. And also we have a new building coming out. A College of Health Sciences building that is being built, almost done, scheduled to open this summer.
All right. Where's that at, Hattie?
Actually, it's just 2 streets down from our main campus, so it's part of our main campus.
Is that the one in Orange or the one down in Irvine?
That's the one down in Irvine, yes.
Okay.
There is another hospital that we're also building that's coming up too. So we're growing, we're going, and so we're very excited to have the College of Health Sciences, which is a interprofessional of School of Medicine, School of Nursing, School of Pharmacy, and School of Public Health.
So I must say that's one thing that amazed me in medical school is once you get in, the amount of support you get in these advanced care is just amazing. All right. So in the graduate schools of healthcare, people want you to be successful. They will help you succeed. It's just floored me because you're used to that people not helping you succeed a lot of time. Chris, talk to us about Western.
I'm over here still trying to think how we can follow up with that free tuition. I don't know how we're gonna follow up with that one. That's awesome. That's great. When I get this question asked, I try to condense it down as much as I can because I feel like there's so many things that I can talk about Western U that sets us apart and a lot of the things that I love. We don't have free tuition. We do have a lot of scholarships that a lot of students are able to take advantage of. But, of course, there are things that, we can talk about as far as, things that are important to keep in mind, like numbers, right? So, that we are typically above the national average in COMLEX passing rate, which is the licensing exam for DOs. We're consistently above the national average for residency placement. And so all those are on our website. So those are really important things to consider, right? And what is important about schools. But I think also looking at other unique things and just like Haiti, we also have an IPE curriculum in the DO program, and we really find that our students really enjoy that as well. And because we're a graduate health professions institution, we do have a lot of other programs like our pharmacy program, our physical therapy and nursing program. So a lot of those students are going to be in that course with you, just like she explained in that case study and working collaboratively together. So that's really awesome. We also have longitudinal tracks, which I think is pretty unique and awesome as well. They're completely voluntary in addition to your curriculum. If there's something or a specific interest that you have, you can apply to that longitudinal track. So for example, we have a longitudinal track in global healthcare, community healthcare, nutrition. And what these longitudinal tracks do is give you some extra training. And then we also work with other specifically nonprofit organizations within the community and things like that. So if you wanted to do the nutrition in medicine. You would, learn different, cooking classes and things like that, and how to live a healthy lifestyle. And actually, I'm calling it the nutrition. It's actually lifestyle medicine track. Sorry. And so, how to stay active. And so, you also are very heavily involved in the community. Which also brings me to my next point about Western U, is it's very, very big on providing healthcare services to the community and underserved communities. And so we have campuses in Pomona and also in Lebanon, Oregon. And so in Pomona, there's a lot of need for providing a healthcare service to a lot of the underserved community. And that's a really big piece that we really, really want to make sure that the students that are coming into the program, that same value aligns with them. And that's why I talked about volunteer work and how it's really important to have those hours and working with your community, because that's an important piece. In fact, you're also going to be required to do some volunteer work in the program, and then you can also get more involved. I talk about our pillars, which is science, caring, and humanism. And so this is something I recommend any school that you look at, what their pillars are, what their mission statement is, and does that align with you? Because like I said, all those other things that I mentioned about numbers and placement rates and things like that, that's great, but you really want to make sure that those also align with you. And so again, that's really important for us. And anyway, so I know we're short on time, but I'll stop there. Like I said, I can go on forever on this one, but I'll stop there.
Thank you, Chris. And I would love to talk more about for students to understand the difference between DOs and MDs, because we're actually merging, right? We're coming closer and closer to each other. There are still some distinct differences, but unfortunately, if you want to write something in chat, that would be great. We're up to Michelle next, and Michelle, I have to thank you for answering all those students' questions in chat, because
no problem.
It really helps them. So talk us up about what happens at Cal State Fullerton.
So I think part of what makes us unique compared to other nursing programs, so I'm sure many of you know nursing is incredibly impacted, incredibly competitive. It's wonderful that so many people want to be nurses, but we just don't have a lot of space. Something that makes us unique is we use a system, even pre-pandemic, called Proctorio for all of our tests and quizzes, which is an online proctoring system, which is very similar to the NCLEX, which is your board exam to become a nurse. So we have found, actually, with our very first cohort that did all 4 years or 3 years or 2 years, depending on which pathway they came through, using Proctorio the entire time, we received 100% pass rate on the NCLEX. So we really think this helped manage the test anxiety that students had going into this very large test. They already sort of knew what it would be like. They knew how the online testing would work, the online whiteboard. And so I really think that this helps prepare students for the NCLEX. The other aspect is that we use NCLEX style questions from the beginning. So anyone who is familiar with nursing will know that NCLEX style questions are very different from regular multiple choice questions. For example, you may have a question that says, what color is the sky? And the answer is blue, light blue, dark blue, medium blue. And all of the answers are right, depending on where you're looking, what time of day. You just have to pick what is the most right now. So that's sort of an example of how nursing questions are. Every answer will be correct. You have to pick the most correct. So this is very challenging for a lot of our students coming in, because it's not how we're taught to do multiple choice for the entirety of education leading up to nursing school. And so we really start those from the beginning, so that by the time students get to the NCLEX at the end, they feel well prepared. So I really think those two aspects set us apart. Additionally, just like all of the other programs mentioned here, we have that one-on-one support. All of our faculty and staff here want students to succeed, and really highlighting what everyone else mentioned as well. We want to make good nurses. We want everyone to have a great experience. And of course, no free tuition, but being a Cal State, it is on the lower end. So, yeah.
Thank you, Michelle. We have 3 minutes left. For those of you that, if you can stay to the very end, we have both Dr. Salcedo and Dr. Hur talking about what work experience you can get, or shadowing experience, and how we offer that at Coastline. So if you need that type of experience, please stay with us. Does anybody want to say a last? The other two questions we had was about grades, right? Because everybody always asks about grades. Anybody want to give? I'll just go through, and everybody, if you want to give a 1-minute spiel about what about grades, all right? So they're always worried about grades. So I'll start with Sarah.
Yeah, so grades, I mean, they are a factor within our program, but our application is through a holistic review. So even if you struggled within like maybe your undergrad, your science GPA, we're still going to look at other areas of your application. Our minimum is a 3.0 for both overall and science. But again, we're looking for that connection, like a lot of the other panelists said. The connection as to your why. What's your journey? What does it look like? Why do you want to be a PA? And so even though it's just a factor in it, it doesn't mean it's necessarily going to make it or break it within the application, because it is actually going through that holistic review process. So I'm going to shorten my time since we're running out.
Yeah, thank you. Agesha.
Grades are very important, but I think many schools will probably say the same thing in regards to holistic review. And that is something that we are very committed to. Actually, we don't have a minimum GPA or MCAT score requirement for our school because of the holistic review process. I'm not saying that MCAT and GPA is not important. You definitely have to be considered competitive. And I always get this question, well, what would be competitive? I think maybe 3.0 or higher would be considered competitive, and MCAT score above a 500. Obviously, we would love to see those scores and GPAs higher, but I know people want something to stick with. But that is what I would say in regards to grades and GPA.
Thank you, Agesha. Hetty.
Our program has a recommended GPA of a 3.0, but I'm a half glass full kind of person, so I'm going to say it this way. Don't think of grades or GPAs as a gatekeeper. Gauge it as a preparatory mechanism, because if you do well in your undergraduate courses, you're more likely to be well prepared for the foundational courses that get even harder later on when you get into a health professional school. So we just want you to be prepared. And so therefore, think of it that way. The better you do now, it makes it easier for you to transition later on. So for example, if you want to show a progressive trend, let's say general chem just wasn't your cup of tea in the beginning. It's very difficult. So slowly show that progression, that I can do this. Yes, this was hard here. It got a little bit better, and show that upward trend, and always constantly be self-aware. What are you doing differently? What can you do differently so that you can improve in the outcome that you want to see in your grades?
I must say one of the best things I ever got was from a high school student, high school teacher at my son's high school, where he said, learn the material and the grades will follow, right? And that's happened. So if you concentrate on learning the material, which you're going to need anyway, right, the grades are going to follow. Chris?
Yeah, so when I get this question asked about grades, I'll be honest with you, I'm transparent as much as possible. I want to make sure that it's my job to tell you the truth, right? And how you can be competitive. And yes, just like everybody else, we do look at the application of holistic view. So yes, GPA, MCAT is not the whole thing, but I will share with you the averages of students who were accepted into the program recently, where GPA for overall and science were about 3.6 to 3.7, and then MCAT was 507. So again, those are averages. I really want to be careful with that and say that doesn't mean we don't have a minimum, but it's really important to understand that, because many times we see, students will start off, a little bit rocky, a little bit low in the GPA, and just like Katie said, get that upward trend, right? Get those grades up, and that will definitely help strengthen your application. If you need to do a post-bac, if you need to do a master's, just because you're not there yet doesn't mean to give up, or that you don't have a chance. So if this is what you really want to do, get there, but know that it's very competitive. So again, I just kind of also want to be transparent in that sense as well. And we also do offer advising appointments, so I'm happy to go into more detail about that. I put my email in the chat. I did a brief quick answer about difference between DO. That was a very, very short, but there's a lot more that I can talk about. But I didn't enter my email if you'd like to set up an advising appointment over the phone or online as well. So yeah.
We could do a whole summit just with all of you. Michelle.
Well, I'm not going to have such a great answer compared to everybody else. GPA is the highest thing that we look at in our holistic process. Nursing is incredibly competitive. And the good news about nursing is that we have so many programs in the state of California and so many here in Orange County alone, ranging from associate's degree in nursing to bachelor's of science in nursing to entry-level master's for nursing. So there are different programs that do a lottery. There's programs that go based off of merit, et cetera. We are a merit-based program, although we are also holistic. The minimum GPA is a 3.25. I sound very harsh compared to Hetty and everyone else. Unfortunately, if you have less than a 3.25, I would not recommend spending $70 on the Cal State application to apply, because you will not be looked at, because we receive thousands. If you do have lower than a 3.25 in your prerequisite GPA and your cumulative GPA, I recommend looking to associate's degree in nursing programs. You can go from an associate's degree in nursing to a bachelor's of science in nursing through an ADN to BSN, or sometimes called an RN to BSN program, which we offer, Cal State Long Beach offers, Cal State LA, et cetera. And those GPAs are much friendlier than our pre-licensure programs of 3.25.
Great. Well, go
my
ahead.
internet froze, so I think Michelle's done. Paula, you're gonna have to take over. You might have to take over for me here.
Yeah, well, thank you again for all the panelists for joining us today and spreading your wealth of knowledge. I'm going to include all their emails on the event page. So if any students have any follow-up questions, please reach out to them. They're more than happy to help you out. Thank you so much, all the panelists.
Yeah, thank you very, very much. We could have spent the whole time talking. Thank you.
All righty. So for the next part of the event, we're going to be doing the expert panel session.
We've got some questions. I also have some that got submitted from students previous to the event starting today. So we'll include some of those in here today. But why don't you each start off kind of introducing yourself, but also giving us an idea of what your typical day looks like in the workplace, just to paint that picture for students. Denny, do you want to kick us off?
Sure. Good afternoon. Good morning. So a typical day, I chose to do 3-hour, 12-hour shifts. The only reason you don't have to do this, but I just wanted to get it over with. So at the end of the day, 8 hours, 10 hours, 12 hours, I'm like, it's all the same after a while. So I did 3/12. So it gave me the opportunity to have the 2 days to do something else. So with healthcare, there is a lot of flexibility with all the panels, nursing, PA, DO, everything. So it does give you that flexibility. Usually a typical day in 12 hours, I see new patients. So a new patient would be an evaluation. If they come in for shoulder pain, back pain, knee pain, would view evaluations. And then treatment would be, depending on what they're here for, would be a treatment as well. The majority of the time in the morning, I see patients, but then we get about 30 minutes or more to document. That's probably when you go into what's the least favorite part of my job is probably the documentation. But, you have to document because you want to cover your end and, of course, the patient as well. And that's about it. I mean, a typical day is 12 hours of seeing patients nonstop. I see patients every half hour, but some people come early, some people come late. It's just, you just work it out. And you have to be flexible with all of our healthcare. You just got to be flexible and just go with the flow. You can't be like, oh, you're 5 minutes late. See you later. That's, we have to, it is a business, right? So you have to treat them as they come in, and because they are there to get help for pain or pain relief. So you don't want to push them away because they're already under stress and they're already having a difficult time. So we want to help them as much as possible. But that's about it.
Great. Elaf, you want to go next? You're mute.
Can you hear me?
Yeah, now we can hear you.
Hi, everyone. I'm Elaf Farhat. I'm a full-time instructor at Coastline, but before that, I was a dietitian for many years. And it is hard to indicate how my day goes as a dietitian, just because there are so many different areas to work on as a dietitian. Personally, I was in the inpatient setting. I was an ICU dietitian, and briefly that I go in, I check out all the patients' charts, I go up to the unit, meet with the team and have rounds with the medical team, like the physician, the nurses, pharmacist, PT. So everyone, we discuss the patients. I go and talk to them, the patients or the families, and then I go back down to my office, which is usually in the basement, right next to the kitchen. All the hospitals I worked at, that's kind of the setting. And then I just chart for everyone. But with that being said, there are other jobs. So you can be an outpatient dietitian where you see patients, like you do the one-on-one, similar to what Danny just described, where you meet with the patient and then you chart after. Or you can also be a school dietitian, where you do all the menus for the kids. If kids have any allergies, you're making menus for them, doing rounds by all the different schools. You can be in more like research in a nutraceutical company. So there are a lot of different positions, and all the positions will have different setting. But in the hospital setting, usually dietitians work 8-hour shifts, unlike nurses or unlike the PT, for example, what Danny was describing, where they work 12-hour days. 12-hour shift.
Now it's helpful to think about all the different settings that the same position can have, because you see that even as a parallel, Denny, to your to PT athletic training. A lot of people think that they're very similar, but their settings are often drastically different in which they're working. So thank you. Rhonda, am I saying this right?
Yeah, Randa.
Good. I just want to make sure.
Thanks, Lori.
Yeah.
Hi, everyone. My name is Randa. So I am a senior global clinical project manager for a contract research organization. Contract research organizations are hired on by pharmaceutical companies or biotech companies to run their clinical trials. So if a pharma is looking to get a new drug approved, they go through a CRO or contract research organization to run the clinical trial for them and bring on sites and get patients to get to those sites. And we analyze all of the data and provide it back to the pharma. And they do all the marketing from there. So a typical day for me includes several teleconference meetings where I'm meeting with either the client, our internal departments, or vendors to provide updates and receive updates on the different functions that they're working on, and then communicate it back to the sponsor. So I'm always planning for milestones and deliverables that we have agreed upon in the original scope of work and the budget that we have with the sponsor or the pharma company. And the clinical trial roadmap, in essence, is very lengthy, but anything that I could be working on from study startup to study end would be like site selection. So selecting the proper sites for the clinical trial, depending on what the drug is. So if it's a dermatology drug, then we're looking for dermatology offices that are the indication is like, if there's a specific rare indication, then we want that dermatologist to be an expert in that indication and make sure that they see patients that have that condition so that we can provide them the medication. Or vendor selection. So we work with a lot of labs, MRI, making sure that we have the correct vendors contracted for the clinical trial so we can get all of those, all the equipment and items on site for the site to work with. And then I have a lot of other just day-to-day project plans, trackers that I work with, making sure that the budget and timeline is going accordingly. And of course, making sure quality across all departments are there and reviewing risks on a daily basis and trying to mitigate them. And in essence, at the end of the day, just making sure that patients that are taking the medication throughout the study are not having any adverse events, or if they are, documenting those and going back to our medical monitors and ensuring that they're getting the proper care they need. It's all about patient safety, of course.
And how much travel, you talk about the different sites of the studies, how much travel is involved in what you're doing?
So as a project manager, I don't travel myself. The only travel I do is usually at the beginning of the study to meet with the sponsor. But we have clinical research associates who I manage, and they're the ones that go out to the sites and they review the documents and review the quality and make sure that the just reviewing the quality of the source documents and all of the paperwork. And the CRAs do travel quite a bit. So they're traveling about 3 to 4 days a week, every week.
Got it.
Yeah. And that really depends on just how often the studies see patients as well. So if it's a rare condition and they're not seeing patients as often, then they'll go out once every month. But then if that's the case, then they're definitely on other studies where they're still traveling on a weekly basis for another study.
Got it. Yeah. Rich? Okay. Well, I'm going to ad lib Dr. Henry. Do you want to tell us what the average day of a neurosurgeon looks like?
Oh, well, I don't know if there is an average day, Dr. Runk. So neurosurgery is like most clinical practices of surgeons is you spend some days in clinic and you spend some days in OR. And then you spend a lot of days on call if you're a neurosurgeon. So there's only about 3,500 board certified neurosurgeons in this country. So that means you're covering a lot of patient population. So a surgical day can be short cases or long cases. People always ask me, what's the longest case I've ever done? It was probably 20 hours. I only did that once and I realized I'm going to break cases up because you can do that. You can do half the case and come back and finish it at another time. The short cases can take 20 minutes if you're doing carpal tunnel surgeries. By the time you prep and do everything, it's about 20 or 30 minutes because there was all that prep time. But you operate all over the body. So it's really nice. I've operated on brains. You operate on bellies when you put shunts in for a condition called hydrocephalus, which means water on the brain. I did a lot of peripheral nerve surgery because the nice thing about peripheral nerve surgery is you don't need to go through bone to get to a nerve in the body. So it's kind of nice, and there's a lot more dissection type skills. So for those of you taking an anatomy or a course where you're learning how to dissect, it's a helpful start. It's a helpful start to it. So the clinic days can be challenging when you see patients in clinic because sometimes you're the bearer of bad news, right? And you have to realize there's no good way to tell bad news. There's only better ways and worse ways to tell it. But when you're giving bad news to patients, you have to be really cognizant of how much they're hearing, because they sometimes don't hear past the first sentence you say to them. So over the years, I've learned how to tell bad news better. There's no good ways to tell it. Perhaps one of the most impressive things I ever went to was I listened to Michael J. Fox at one of my neurosurgery conferences. And for those of you who know the actor, he has Parkinson's disease, and he talks about his experience of how someone told him bad news. And the first neurosurgeon he went to, or neurologist he went to, he left. He never went back to him because he was the one who told him the bad news. And he calls that seat across from the doctor the bad news chair. So it was really impressed upon me how we need to learn as physicians to really communicate with patients. In fact, I'm going off topic from Dr. Runk here, but one of the things that I always tell people when I try to teach them is that it's usually when we can't make a diagnosis, it's usually because we didn't ask the right question as a physician. All right. The patients, if you ask why are you here? Why did you come in today? And someone talks to you about back pain, and one of my anatomy students wrote how her back pain was misdiagnosed, and I could see just what happened in her clinic just by reading her paper, because she came in with the idea that her pain was in her back and due to her back, and that was the pathway they followed, and she ended up having gallbladder problems, right? Because someone didn't ask her the right question. So that's why you're learning all this stuff, so that you can ask people the right questions down the road.
Well, thank you for jumping in willingly on that. We had a student question that came in from one of my classes prior to this to kind of feed off of what your normal day looks like is who are the people that you're working with? So a lot of times now, and we even heard on the panel examples such as Western and some of the other schools where they're taking classes, or you've taken classes, you're working on a regular basis with other professionals. So who are some of the other health professional positions that you're continually interacting with on a regular basis in your career? And whoever wants to start on that.
I guess I can go, just because as a dietitian, we interact with a lot of professionals. So for example, we work a lot with speech and language pathologists because SLPs, because they usually do a speech evaluation or swallow evaluation. And that makes us work together. So they would assess a patient and say, okay, this patient needs to be on a modified diet, where it needs to be puree diet or thickened liquid. So then we work hand in hand with them. Or we work a lot with pharmacists, for example. So dietitians need to be aware of the different medications, because some medication interfere with the diet. For example, if they're on warfarin or Coumadin, and they need to have avoid specific foods. We also work a lot, obviously, with the nurses, because everyone works with the nurses because they're the ones that work with the patient. So you ask the nurses stuff about the patient. And that's why you have to have a good relationship and open communication with other health professionals. Obviously, if you're working as part of a team, you might need to talk to the physician about it. Tell the physician, I talked to this patient or the family, and we need to liberalize their diet, or this patient isn't eating well. Can we modify the diet? So you need to explain it to them. A lot of times I had to be actually a patient advocate and talk to the patient, especially in the intensive care unit, where a patient is intubated, so they have a tube in them. So basically they're kind of like in a coma. So I have to be the one that advocates for them and to the team. You're like, okay, this patient was not fed for 5 days. We need to do something about it. We need to start tube feeding. So yeah, I feel like in healthcare in general, it's such a multidisciplinary approach. So everyone works together.
Yeah.
Yeah, to kind of piggyback off of that, obviously, we all work together. Dr. Henry, she's the one that does the surgery, but then they come to my clinic and I'm taking over right after that. And then during that time, maybe I noticed that, hey, they're not doing so well. Maybe they're diabetic and they need to be referred to a dietitian, or they need to go back. So there's a lot of interdisciplinary work, and you have to be open to that. And maybe there is someone that forgot. Look, I had a patient that came in, and she told me that she had a pain every time she ate fatty foods, and she was in for musculoskeletal. I'm like, fatty foods, and then obviously it was a gallbladder issue. But like Dr. Henry said, did you ask the right questions? She just got kind of pushed in, didn't ask the right question. It's like, oh, if your back hurts with eating fatty foods, probably not musculoskeletal. Let's go look at that. And then kind of talking to the physician and going back and say, hey, so you have to be whatever you choose, whether it's PT, DO, MD, everyone's going to work together. At the end of the day, pick something that you like, and you don't wake up in the morning like, oh God, I got to go to work. You know, it's something that you enjoy, and you're like, all right, I'm going to see patient day. All right, I'm going to do this. And then, you know, everybody works together, and you want to be happy with what you choose, because it's a long educational process. You don't want to regret it after 8-10 years.
Right.
So,
Denny, on your side, as far as other professionals you're working with, how many times are you working with PTAs and some, because we have a lot of students kind of entering, they might be aides or assistants right now. What is your interaction? How much hands-on work do they do versus you with the patient, that kind of thing?
For sure. I also teach at a PTA school, so at Stanbridge in Irvine. So we have a huge interaction with PTAs as well. Yeah, but I'll do the evaluation. PTAs cannot do the evaluation, so I'll have to do the evaluation and then set up a plan of care. So we're working together to set up a plan of care, and then the PTA will take over the plan of care. But you're always interacting together. So the only limit to a PTA is they can't do the initial evaluation, that they come in with the diagnosis. So the PT has to do the evaluation. But other than that, then we work together to make sure that the patient is getting the proper care. So
great. Thank you. Brenda?
So I can, similar to what they said, we also work with several healthcare professionals on a day-to-day as well. We have medical monitors that we work with. They're the ones that oversee the clinical trial itself to make sure that if anything happens with the patients, we go back to them for advice and action. We work with pharmacists because the pharmacist at each clinical research site is the one that's putting together the investigational product or the drug to give to the patients. The principal investigators, who are the doctors on the study, constantly working with them as well, because we consider them the key opinion leaders. They have a first interaction with the patient, so they can let us know past experiences, current experiences, what's happening from their experience with seeing the patients. So also in our industry. And it's actually part of one of my favorites too, is talking to the medical monitors and the PIs, because then you really see for hands-on that interaction and how they're dealing with the patients, rather than the day-to-day corporate life that I'm always working on.
It seems like from each of you, it seems like the clinical understanding and being able to articulate and speak the language of the people you're working with in different positions is critical for the success, because obviously it's not just your specialty that you have to speak. When I say speak the language, like the terminology, but really you have to know how things are charted the same, and how the role of that person impacts your patient care. And so it seems like that kind of covers all fields, connecting them.
Absolutely.
So Dr. Rank, do you mind if I answer that question too?
Go for it.
All right. Hopefully my internet's been really funky today. Because the doctor interacts with everybody, right? So I just wanted to start with the nursing. So we interact with the charge nurse, we interact with the floor nurse, we interact with the ICU nurse, we interact with the nurse anesthetist, if they're the person that put the person to sleep. We have the nurse, the OR nurse that's handing us the instruments. We have the circulating nurse in the OR that's doing all the charting and making sure the OR nurse has the suture threads and the tools. That's important. We interact with everybody that's cleaning all the instruments. After the patient is out of the OR, again, like Dr. Patel said, we interact with the physical therapist, we interact with the occupational therapist. If the person can't swallow, we interact with this dietitian, the speech pathologist for their correct diet.
Interact with the IT to make sure the internet is good.
Yes.
The neurologist, the generalist, the cardiovascular surgeon, cardiologist, you name it, we have interacted with them.
It's clearly something where the disciplines, there's a lot of cross-disciplinary activity that goes on in patient care. And really it should. I know that a lot of times there have now been centralized systems that they use in medicine so that you can see what's going on holistically in the patient care. So I see that. Teamwork makes the dream work. You're right. It definitely does. And really, you want your medical professionals to be interacting with each other and kind of being on the same page. So if you don't mind, some of you have touched on this, but what's the best part of your career?
So as a dietitian, I love that we have so many different opportunities to work. So if you're someone who just always loves the change, loves the challenge. For example, I love learning new stuff. So whenever I feel like I got saturated with one thing, I can move to a different position. So I was a dietitian covering like variety of floors. And then I chose to become an ICU dietitian. And so you can always choose different things, or you can change from hospital setting to anything else. And there are so many different opportunities, and you can reach out to me if you want to learn more about it. I'm not going to get into all the details. And I also love that there is a great work-life balance when it comes to dietitians, just because our typical 8-hour days. So there's more opportunities for work-life balance. And then in nutrition, there's always new research coming out. Sometimes milk was good, then now milk is not good. Vitamin D is not, you don't need that much vitamin D. Now all of a sudden, everyone needs a lot of vitamin D. So there's so many. Eggs were not good for a long time, and now eggs are good. Fat was not good, and now we all need fat. So it changes so much. And I love that there's always new research that you need to follow up on. You always need to be updated with what's going on. So I do love that. I'm not just, my practice now is completely different than what it was when I first graduated. So that makes it always interesting.
You're forced into lifelong learning, but if you enjoy that, it's perfect.
Definitely.
Yeah, I can touch base on why PT is good. I think the main reason is I did a lot of sports in high school, and I went to PT actually, and that's why I got interested in it. So I hurt my knee, hurt my shoulder all the time. So I said, hey, this sounds like a pretty good career because I'm always here. So from a business sense, it kind of makes sense. And that's the beauty of PT. It does allow you to be flexible. But then if you like the business aspect of it, you can open up your own clinic. And that's what I did. So our clinic focuses on mostly sports injuries and post-surgical, like total knees and total hips. But if you like pediatrics, you can go into pediatrics and open that. If you like neurology, you can go into neurology and do stroke rehab and Parkinson's. So there's a lot of flexibility. And I think that was one of the reasons that I went into PT is that, hey, if I don't like outpatient ortho, I'll go into peds. But then with peds, I got attached to the little, so I said, okay, this is a little too emotional for me. So then I went back to, because I really got attached to the kids. So I said, but it does give you the opportunity. Hey, if I want to do peds, I do have the training, I can go in there. And so that's, I think the main thing for our career was the flexibility and the ability to open your own clinic. So from a business aspect, I enjoyed both part of that. So
yeah. I guess I'll go next. Yeah. So I'd say the best part of my career is knowing that even though I work in an office and now a home office after COVID, I still play an important role in improving a patient's life. So several of our patients have an unmet need and a medication that isn't available to them. And even if this patient and whoever it is not directly related to me, I still see that patient as a family member to someone else, a colleague to someone else, your neighbor. And so I'm really motivated by the promise of medicine and helping move the clinical trial process along to help this medication get approved quicker and get this patient the medication that they need to help their condition.
Do you enjoy, what made you pick the non-patient facing aspect of healthcare? Sorry, just to prove that a little bit.
Yeah, so I did a couple internships at hospitals, at a skilled nursing facility, and at a regular hospital. And I felt like I was a bit too emotional to deal with the patient directly, like it was affecting me on a day-to-day basis. So when I just took a step back, I thought, okay, maybe I can go into the business aspect of things, but still be somewhat helping a patient in some other way. Yeah, because I'm still very interested in healthcare, and I felt like, okay, I wanted to go into the healthcare field. At first I did want to work with patients directly, but then I just couldn't handle it myself. And maybe I was still young too. I didn't give myself enough time to dive deep into it. But that's essentially why I took a step back and chose the business aspect of things.
Still helpful to patients, but you can remove the emotional side a little bit. That's awesome. Thank you. Dr. Henry, would you like to answer?
Thank you, Dr. Runk. You asked what the best part of the job was, right? And
get to the worst part.
Oh, okay. I hate to say it, but it's really being able to take care of patients, right? And because it sounds like a tried answer, but it's really true. Is the ability in neurosurgery is you can really change somebody's life.
I have something to add if she's not.
Okay, add, and then we'll allow her to jump back into best part when we get to the worst part.
Yes.
Okay, go ahead.
So also, obviously, I'm a dietitian, so I believe that food really is the first line of therapy for most of the diseases, if not all of them. So really learning about nutrition and educating the patients about nutrition, you can always treat most of the diseases just by educating them about the proper nutrition. So that is really rewarding.
I see that your associate is helping you this morning.
He is. Associate has a runny nose today. Can't go to school.
I love it. I love it. That's the new world of all work fields right now.
Work-life balance.
That's right. Everybody gets a nice demonstration of that. Okay, well, we'll jump into the worst part as well, because everybody wants to hear that you don't want to hear it, but we all need to hear it. So Denny, you want to kick us off on this one?
Sure. I mean, I think the worst part is probably, like I mentioned earlier, is the documentation. I could see patients all day, but then having to justify why I saw that patient but I mean, obviously there's a need for it because you want to protect the patient, you want to protect yourself. But that's probably the worst part of it. And then, I really can't find too many negatives, and I don't want to discourage anyone, but just the documentation part is probably the worst part of it. This probably goes with any profession, from neurosurgery to RN to dietitian to dentistry. It doesn't matter, but we all have to justify it. And the documentation is getting worse, meaning I have to justify more and document more why someone needs treatment after a surgery. Like it makes sense, but I have to justify why they need treatment after their surgery that they just had somebody cut open their knee. But that's I would say that's the only drawback, but you can't get around it. It's to protect the patient and yourself, so it is what it is. So
What class helped best prepare you for all of the medical charting documentation, do you think?
I'd say my English class. What's funny is that you're right. English and being able to articulate and writing complete sentences, and not using nowadays. But when I went to school, no one did this. But even students these days, they write in their short LOLs and all that. You can't do that with documentation. Okay, so you gotta learn how to write complete sentences. Even like you write to your professors, write a complete sentence in your emails. Don't write like that in medical charting. You cannot do that. You can use medical abbreviations, but don't use any of the slang that you use to communicate, because that's not good. So taking a proper grammar and English class and being able to articulate what you're trying to get, because you have to paint the picture of the patient. The people that are reviewing your charts, they're not seeing the patient in front of you. So you have to be able to articulate and say, what is wrong with this patient and why do they need this treatment? So being able to justify that is very important. So if you have difficulty, I would definitely recommend taking the proper English class and the grammar classes, because that's very helpful. And it makes your life easier, because then you can get approved for the treatment without having to rewrite it and say, well, I meant to say this. But so.
Well, a plug for Coastline's English program. They are actually they have a class for scientific writing. I don't know, Paulo, you might not know off the top of your head, but they designed it because we asked for specifically scientific writing, not so much just general writing, because it does have a different flow to it, and the training of writing more in a research type setting is different. So anyway, somebody can follow up with me when I actually have the information if they need to, but we do have a class that prepares you for that. Brenda?
So I think the top stressors in my day-to-day are managing the stakeholders, so basically the pharmaceutical company and anyone that's involved in the trial, and being uncertain, like just having uncertainty of the project and accomplishing the project itself. So with managing stakeholders, it's one of the project manager's main responsibilities to communicate with the team and keep everyone on the same page. So we're always trying to connect the dots and then enable collaboration between all of the project stakeholders. And managing that is just a never-ending process. And similar to Dr. Deborah, I think that said earlier, always trying to provide bad news in a better way, constantly doing that, because there's always things that come up that change the requirements of the study. And then you have to take this back to whoever's involved and let them know that you've thought of all of the risks that are involved, and then you've been able to mitigate the risk and what's the situation moving forward. So trying to spin it in a way where you have everything under control. And then, just as I said, things are constantly changing. There are times where principal investigators think that they have the patient population, and then they actually don't, and they're not able to enroll enough patients by a certain milestone. And so changing timelines around. When, as a project manager, we're always trying to be in control, but there's things that are out of our control. And that's actually very difficult for us to feel like we don't have that all under our belt. But at the end of the day, I think you always embrace the challenge and learn how to handle uncertainty gracefully and work with it and communicate back to everyone that's involved.
Gracefully being the key. I like that you
Yeah.
Having people is always a balance of using a bit of grace. So, Dr. Farhat?
So I would say one of the greatest challenges is that as a dietitian, or you're always educating the clients, but then there's always a level of motivation that needs to be there. So it's not always in our hands. So I can educate someone for hours, but still, if they're not really motivated, obviously you still need to use like motivational skills and stuff. But if they're not motivated enough, there isn't really that much you can do. So I feel like that would be one of the most challenging things about it.
I found that when I worked in cardiac rehab, people would come out of having a cardiac event and I would be baffled at how healthy lifestyle adoption wouldn't be the next obvious step in rehab. But I can.
That's actually one of the, thinking about it, the main thing I can think about is how someone has like a heart failure and you just tell them like, okay, you really need to avoid too much fluids, for example. And it does not register. Like they would still eat a lot of salt, drink a lot of fluids. And I can think of one person now who actually did die after that. So you can educate someone as much as you want, try to motivate them as much as you can, but then it's a lot of it on their end too. So I find that very frustrating sometimes, and it can be really sad. Like in this case, like a patient I connected with and talked to him so much, and then I just found out that he died.
Yeah, and this goes to anybody working with patients. We had a follow-up question. How do you handle patient compliance or not? I think that's the other part of it. Whether in the research studies or in rehab or in any of these, patient care in general, you have the human factor.
So yeah, it is hard. It's hard to make them. You can't force them to comply. You can motivate them as much as you can. You can try, but
yeah, following
so much.
Making sure that they feel you care about them. Yeah, there's only so much you can do.
Yeah, I think exactly. As far as patient compliance, I mean, let's say a patient had a knee surgery. I mean, I can educate, say, hey, if you don't do this, you're not going to walk. You're not going to be able to do this. You're not going to be able to spend time with your kids. But at the end of the day, then it's on them to say, okay, I'm going to work hard. And it does make a difference. The patients that work hard, they know what they're doing. They make a lifestyle change. They make a diet change. They do all that. They do get better. But there's some, I'll be honest with you, when I first graduated, I wanted to help everybody. I was like, oh, you're going to do this. And then I found some patients didn't get better and I blame myself. And I'm like, oh my God, I suck. But then I quickly learned the human factor that, hey, some people just unfortunately just don't get better. And then this is where the healthcare system, they just get in this rut. And it's just like, okay, well, there's one after another because you had the surgery, you knew what to do, but now you're going to have another surgery because you didn't comply with what we told you. And it just becomes a vicious cycle. So the education is important, but at the end of the day, like you said, there's a human factor. Humans are humans. There's only so much you can do to help them. You do the best you can. And now you don't have sleepless nights, because I did in the beginning, because I'm like, oh man, I'm no good. I'm not helping these patients. But then I learned that, hey, there's some things that are out of our control.
Yeah. Do you want to address the best and worst, Dr. Henry? Because I see that you're back on and you're moving. So that means you're there.
I'm moving. I'm so happy. Yeah, my poor internet. So the thing is, when I was really able to help somebody, so neurosurgery can actually make a person who hasn't walked, who can't walk again. And that has happened to me. And there's no greater thrill than to really change somebody's, you guys are frozen. It is, neurosurgery has extreme highs and extreme lows to it. So when people ask me, what does it take to be a neurosurgeon? I say, you have to be able to ride that emotional roller coaster, because one day you may pronounce a child dead, and the next day again, you may be able to make somebody walk who hasn't been able to walk. Somebody sees who has a tumor pressing on their optic nerve that can't see. So, I mean, it's huge highs and it can be huge lows. And for me personally, I love the neuroexam, which is how I ended up in it, because neuroexam is really like doing puzzles. It's sort of like Dr. Patel there is you're putting puzzles together to figure out where the lesion is. Talk about
patient compliance. we have amazing power as healthcare patients can do. And I'll never forget early in my career, a woman came to me who had back pain, and I said, try losing 50 pounds. And I thought, that's better than a surgery. She came back and she lost 50 pounds and her back pain went away. And I was just going, somebody took my advice, And so we do have amazing power to change people's behaviors. And so yes, there are patients that won't comply and won't do this, but then they don't come see you anymore, right? But the ones that do, it's just amazing. Worst part, like Dr. Patel said, is paperwork, right? Is getting paid, is for me, sometimes it's people not understanding what neurosurgeons are capable of and what they're not capable of. As one of my fellow partners said, I didn't wear my God t-shirt today because there are things that bleeds in the brain that are so severe. You can operate on them, but it's not going to make a person better. So and you work with a lot of people that don't understand the breadth of what you can accomplish and what you can't accomplish, and that was sometimes difficult. And I think it was difficult sometimes being a woman in a very male-dominant field. When I was practicing, probably maybe 5 to 7% of neurosurgeons were women. So it was difficult in that regards too.
So concluding question, what's your advice, and we'll hit everybody on this, what's your advice for someone looking at career options for applying to postgraduate healthcare programs of all sorts, just in your experience, but also what you've seen?
So I just like to follow up from the previous sessions where they talked about the admit applications. And I would agree with them that also shadowing that professional that you think you want to be. For example, if you want to be a dietitian, shadowing a dietitian might be a great example to help you with this application, or just knowing what you want to do. Anyone else?
Sure. Similar, I feel internships are amazing so that students can figure out where they want to go next, even working in different companies and different positions. I do think that when you're a student and you're young and you're so eager and you feel like you have to move up to the ladder so quickly, you always think that you have to start somewhere and then move your way up to that next position after. But in reality, you can try different industries. Really, if you don't even know where you want to go in healthcare, you have the rest of your life to work. So why not take advantage when you're young and hop around and try new things? And while you're actually working and you're going through your day-to-day at different companies, you'll know if you like it or not. Even if it's 6 months to 8 months, it's not so uncommon anymore for someone to get their feet wet somewhere. And, it could or could not be for you. And if you really like it, then that's where your chance to move up the ladder. And if you don't like it, then you move on to something else. That's for someone that doesn't really know where they want to go in the industry.
Absolutely. Yeah. Oh, sorry.
No, go for it.
Oh, I was going to say, like I mentioned, or everyone mentioned, trying to volunteer at the clinic. But a lot of times, don't just volunteer at one clinic, because you sometimes might volunteer at a bad clinic and you're like, I don't want this career. This place is terrible. But then maybe choose another career, or maybe an outpatient or an inpatient or pediatrics. There's different things that you want to see. So don't just base your decision on one clinic or one volunteer, because you might find one clinic is great and one is terrible. And you want to say, I don't want that career based on that. So be careful with that. So
I agree, Danny. I did an internship at a dialysis center and I hated it.
Yeah.
So probably if I did that as my first thing, I might have just changed careers.
Exactly. Yeah.
Yeah, my career certainly wasn't a neurosurgeon when I started out. I started out wanting to do research, and a college professor told me I should go to medical school, right? Because I had good grades and all this other stuff. I said, well, I don't want to be a doctor. Doctors lie to you. They say it's going to hurt, and it's not going to hurt, and it does. So why would I ever, there's no doctors in my family. Why would I ever want to do this? So I went to medical school with the idea of doing research, and I spent a year of medical school doing research, and absolutely did did not like it. Well, I didn't. I mean, there were parts of it I enjoyed, but it's so isolating, and I got tired of killing rats and all this other stuff and running gels, and so I went back and I did surgery first because I thought there's no way I'm going to be a surgeon. Why would I be a surgeon? Let's get boring taking a gallbladder time after time and time again. So I did surgery first. It took me 2 weeks to go in the OR. I didn't want to go in the OR. I didn't want to see blood. I don't like blood. I don't like guts. I don't like any of this stuff. And the first case I saw was a mastectomy. And you're thinking breast cancer, well, I'm not going to like this either. I was in awe. I was in awe of the process. I was in awe of draping out the patient. I was in awe of using my hands to work. I love to use my hands. I was in awe of the focus that we required. If you ask me, one of my favorite things about surgery is that I start something and I finish something. All right. That doesn't happen at educate. Well, I do finish things, but it's like it's ongoing. In surgery, I get something done and a limited amount of time, and I finish something, and I get to use my hands, and it's artistic and it's creative, and oh, it was so, and then the first time I saw a brain, brain actually pulses with your breath. All right. So it actually moves up and down. And the first time I saw it, it just grabbed me. It was just unbelievable. So here's this person that did not want to be a doctor. All right. That wanted to be a researcher, that did not want to be a surgeon. All right. Picks the surgery field that has the longest residency next to cardiovascular surgery. Right. And I end up doing it for 26 years. So open your doors. There is something out there for you, and you may be surprised.
That's a good testament to the field as a whole. I grew up with a father that sold medical malpractice. So that gave me and going into pre-med, that definitely altered my course a bit. But as long as you're a good doctor, it doesn't matter. All right. So thank you guys so much for all the wisdom that you have provided. Paolo, I'm going to kick this one back to you.
All right. Well, thank you again for all the panelists that was able to join us for this one. Thank you, Dr. Henry, for substituting really quickly. They're very, very fast moving there. But feel free to join us on the next one. But we understand that you do have busy schedules. So for the next part of this event, so we're almost done. Don't worry. And if you need to stretch, during this, it's totally okay. So for this part, we're going to be slightly talking about the pre-med club and also our work-based learning program. I'm going to hand it off to Dr. Salcedo.
All right, thank you so much, everybody. So I do have a little PowerPoint I just want to share. All right, so I have in a short time the ability to kind of talk about the pre-med club. The pre-med club has been around at Coastline College for the past 5 years now, and it was founded by a really great group of students who were interested in kind of sharing their experiences with their career paths and then assisting other students with their career path as well. So here's our pre-med club here. Our slogan, we just recently picked it. We voted and we picked out building the next generation of healthcare leaders, because that really is what the club is about, helping you in your journey, helping you to become doctors, nurses, and healthcare leaders. So our club is all about networking, right? Coming together, creating a collaborative platform for students to kind of talk about their stages of their application processes. So we have lots of students who are barely starting on their career path, students who are already on their way to applying, taking their TEAS exams, taking their MCAT exams. So it's a great way for students to kind of show you the ropes and kind of assist each other and giving those experiences to students who are barely starting out. So we have students in all levels of stages of their application process. So it's a great way to network. We also aim to inspire students to become more proactive in their communities. So we do a lot of social engagement, a lot of volunteer work, and we do offer a lot of officer positions to help you gain those leadership skills that many of these programs want to see, right? It's not all about just GPA. They want to see leadership, community involvement, social engagement, networking. So we create this network of professionals who will, make a difference in the world. And so here I'm sharing you pictures of some of our events. We have a lot of students who come together. We do health fairs. We do club meetings. Here we have some of our events. We do a lot of guest speakers. So we kind of have our own little mini virtual healthcare summits where in the past we do invite professionals. For example, Paulo comes by and usually talks a lot about the Career Center and all the services they can provide the students. He's been really beneficial in assisting our students with preparing for their interviews, writing great personal statements, Here we have some guest speakers. For example, we have nurses who do come and they talk about their career paths, how they started off as a student, how they applied, and then what a day in the life is like of being a nurse. Here we have a physical therapist who came in and demonstrated to us some of his techniques. He actually worked with the LA Lakers, so he gave us some really good stories about that. He even demonstrated some cupping techniques. Cupping techniques is that form of therapy to help with pain management and increasing blood flow to areas. So we do invite a lot of guest speakers to kind of talk to our students about what the day in the life is like. Okay, and we have meetings. We meet every 2 weeks. These are pre-COVID pictures, obviously, but we still are meeting via Zoom. And we also have many representatives coming from various organizations. So we do have people from the Cope Health Scholars Program come and speak to the students, organizations like donor registries, and then information-based representatives like Bridged Health Programs come and also speak to our students about the services that they provide. Okay, so on top of having great speakers and presenters talking about careers, we also do a lot of volunteer service and community outreach. We have partnered ourselves with the Share Ourselves organization, which is found here in Orange County. They're a really great nonprofit organization that serves the homeless and low-income families, providing to them free mental health care services, free dental services, free medical services, food pantry, rental assistance. And so that takes a lot of money, right? So a lot of our pre-med club students, they work at the big fundraisers that they have throughout Orange County. For example, here in the bottom is a picture of Taco Night, which is a really great fundraising opportunity where people come in, eat lots of tacos from lots of renowned taco chefs around Orange County. And of course, all the proceeds go into the Share Ourselves organization to provide all of these free great services to the poor and homeless in Orange County. We've recently been doing a lot of vaccine clinics. So when the COVID pandemic first started, a lot of our students were able to help out in the community by assisting in vaccine clinics that help vaccinate, thousands and thousands of people around Orange County. And so you can see here, these are all Coastline students, actively engaging in the volunteer services, community outreach. We've done things like beach cleanups, cancer walks. So it's a great avenue to go out there, right? Engage with the community, build your resume, have great talking points when you are interviewed, right? And just kind of, have lots of social engagement. And as always, this is a club, so we do a lot of fun social activities. Again, these are pre-COVID, but now that things are opening up, we are able to kind of meet together and do some fun events. So for example, here we have chair yoga, right? Especially during finals, right? Sometimes we need to de-stress ourselves. So we have like these little chair yoga type of relaxation processes. We do some fundraising. We have our bake sales. Hopefully that will come back now that we're kind of slowly getting back onto campus. Here we are. I even joined in. This is a CPR life support training that some of us have done in the past. So we like to kind of organize students getting their certification on that. And then we help do a lot of college-sponsored events like the Virtual Healthcare Summit and other types of activities. Okay. So if you'd like to learn more about the club, we do have a website. Let me just show you that. Our club website is at Coastline. Here it is. All right. And so at our club website, you'll find information about the club. We do meet every other week. Here's our current schedule. We meet on Fridays from 10 a.m. to 11 a.m. And here are the dates. Here is our Zoom link. So everybody is welcome to attend. There are no club dues. Just being a student here at Coastline, you can just come to our meetings and be a club member, right? We do have newsletters. So I do encourage you to read some of our newsletters. If you click on the latest newsletter, you'll see some of the activities we've done in the past. Okay. And then currently we do have a lot of openings for club officers. We recently had a mass exodus of club officers. They've moved on to, really great things. For example, Janelle, who was our former president, she's now going into nursing school. Our secretary got accepted into optometry school. Many of our prior leaders are now in nursing programs. So being in the club helps to build their resume, give them great talking points in their interviews. So again, if you're really interested in becoming a club officer, we have lots of positions opened. So our next meeting is next Friday. So if you want to learn more, please come to it. Everybody is welcome to attend. All right, I think my 10 minutes are up. Thank you so much.
So welcome, everybody. It's great to see such a wonderful turnout and so many excellent speakers, and we're glad to meet you all. I just wanted to share a little bit. I'm going to share my screen as well about our work-based learning opportunities. So work-based learning is a course that you can sign up for 1 or 2 credits. And during the enrollment, whether it's a 16-week session or an 8-week session, you'll have opportunities to earn experience in a number of fields in the biological sciences, including the allied health fields. Some of the opportunities that we have for you to learn as you're engaging in a work environment include both clinical time as well as research. So I just want to show a few images of some of the opportunities that we offer currently and some activities that we've done in the past. We have 2 physical therapist partners, one in Tustin and one here in Corona Del Mar and Newport Beach. These 2 physical therapy clinics welcome students to come and experience their clinical environment in both volunteer positions that can earn work credit and academic credit through our work-based learning courses, and also the potential to be hired as an actual employee. We do have a partnership with a local physician as well that similar to what Daniel was or Dr. Salcido was explaining, things have changed a little bit over COVID. So if you are interested in working with a physician, we can connect with that person again, but we've kind of paused everything during COVID, and we're just now starting to offer those 3 opportunities in a clinical environment as part of the work-based learning course. We also do undergraduate research. So again, pre-COVID, you'll see in 2018, we had students who actually presented their undergraduate research at UCLA, and in a very welcoming, very supportive, really positive environment. And these are images from some of the research projects that we have participated in and we have ongoing. These are 2 postdoctoral researchers from the Biotech and Biomedical Institute at Scripps at UCSD. Here we are collecting sponges from Newport Back Bay with Back Bay Science Center. We take these sponges and extract the exudates in our lab on campus, and we are looking for bacterial communities that produce antibiotic compounds. This work is also integrated into our majors bio courses and across some of our other STEM courses as well. Right now, this is an opportunity that you can work with not only Coastline, but also with UCSD's Scripps Institute and a global program called Tiny Earth to look for new antibiotic compounds. Sorry about that. We're all used to Zoom with dogs and animals at home and children and pets. We also have more traditional environmental type research. So here we're collecting samples from the Back Bay and we're quantifying the organisms that live there from not only the microscopic level, but all the way up to the macroscopic level. So we're counting animals and microbes as well. And this is called the Marine Life Inventory Project. We have an ongoing research project that involves looking at phytoplankton and zooplankton communities as they relate to the larger communities in the Back Bay. We also have 3D printing available. So before COVID, we were working on a program that printed prosthetics for the pediatric population. We shifted gears when we had to all quarantine and we started working on producing PPE for our frontline workers. So you see headbands here for face shields that we printed and we donated to a group that goes to other countries and provides medical services there. And to give you some information, let me just pull up that slide for you so you can note. Again, if you are interested in these opportunities, you can contact me at tmurray8@coastline.edu. This is either Bio 191, or sorry, Bio 291 or 292, the work-based learning course. If you're interested in enrolling, you'll see it on the open course schedule catalog. And I'm happy to put my information in the chat box as well.
And this is, I just wanted to say one more thing, is that also there's another program that's available called the Cope Scholars Program. You have to apply for it, but it allows you to work at Hoag Hospital in various different fields, from OB-GYN to the ERs to all surgery. And it's usually I think a 2-year program. And if anybody wants information about that, they can email me and I can set you in the person. Or actually, Paulo just put it in the chat box. So thank you, Paulo. Wonderful, wonderful program. If any of my students here want to talk about it, it's really great because I'm sure somebody's been in that program.
Thank you everyone for joining us for this event. Special thanks again to faculty, to all your professors that really, this event wouldn't happen without their expertise, their knowledge, and also our panelists as well. So this next part is just going to be the closing and the feedback. So if you are getting extra credit for coming here, I'm going to put the link on the chat one more time. If I could find it, put the link one more time on the chat for you to fill this out. I added the emails of all the admissions people. So if you do have any follow-up questions, you could just go back to the event page, and I'll send everyone a follow-up email again of the event page, the feedback form. If you have any follow-up questions or need me to connect you with someone, I could definitely help you out there as well. And I think at this point, I think it would be really cool because last year we did this as well. I'm wondering if any of the student in the Zoom room would like to share what their thoughts are, anything they learned, any aha moments from this event. And I know our VIP Jim Ho is waiting to say something.
I can share something. I got an email from a student who was in the event, and she wrote down that she wanted to thank us for the virtual healthcare summit. She was able to hear a lot of helpful advice today at the Zoom meeting. It is genuinely so nice to see and hear how supportive the faculty is and how everyone wants to see students succeed. Something that stood out to me today was the fact that we are on our own timeline when it comes to a professional career, to work hard, but also be kind to ourselves. I enjoyed sitting in this meeting with so many amazing healthcare professionals.
Yeah, I just wanted to say thank you. This was an incredible summit. I loved hearing feedback. Sorry, as you can hear my child. I loved hearing feedback from the alumni and specifically the people that you brought on board to just give their insights to the career that they chose and how it changed, and how putting in the time and the effort to really work hard in your classes and then seek feedback from professors and people like-minded. It was just very informative. I'm grateful for this summit. Thank you for taking the time. I know that this is a lot on your plate in addition to your careers and your faculty. So thank you so much.
Yeah. Well, we all do it for you, for all the students. So Jim, did you want to share?
Yes. It's just a word of encouragement for all the students and for everyone is just this motto that I go by. It's just do not compare your chapter 1 with someone else's chapter 10 in their journey. Oftentimes, especially nowadays, we're always comparing ourselves with other students or other people, and it just puts you down. And so, I just wanted to encourage everyone that we all are on our own journeys. And so it's best that we ourselves are just making that 1% growth in our own journeys. And so if you're better today than you were yesterday, that's all that it takes. And I just wanted to say that.
Yeah, especially if your friends are putting stuff on Instagram, they just bought a new Tesla, they graduated. It's really hard to compete, right? Adrian, wanted to share?
Yeah, I was just saying that I really appreciate the kind of feedback that you get. Like sometimes I think in order to pursue any kind of medical field, you need to be a certain kind of person. You need to be the straight A kind of person. You need to be, and I'm a very like, I need to work very hard for where I'm at. And one things I really appreciated is people's candidness about their career journeys into the medical field and how they didn't think they were the type of person that can look at blood or, you know, like this kind of person. And then lo and behold, when they experienced more or they became more passionate about a certain thing, then they were able to pursue that goal, because that's kind of where I find myself is in that same space. And so I really appreciate that.
Got it. So definitely hearing different perspective helps a lot with that. Would any one of the faculty would like to respond to that or share?
I responded in chat as there's a position in healthcare for everyone. There are so many different opportunities, so many different careers, so many different choices. And you have to remember, just like teaching, healthcare is a service. And the key to working in a service industry is to be a caring person. All right. If you have a lower GPA and you can't be a MD because of that, there is something in there that will work for you, that you will make the amount of money you need to make you very happy to want to go to work every day. And it won't be work, right? It'll be something you enjoy doing. It's a huge field, so many opportunities, so many things you can do, and keep an open mind and you'll find what you love.
Yeah. Megan, did you want to share?
Yeah, I found this event really encouraging. I really enjoyed hearing from the different admissions counselors, because I think there's this kind of, I don't know, overarching consensus that you kind of have to be perfect to get in. And it was really encouraging to hear them say they are looking at the holistic view. A lot of them, I mean, granted, there's obviously certain things we have to accomplish, but it was nice to hear where those numbers really were. That was helpful. But I think the thing that I really enjoyed the most was I didn't realize how many different opportunities there are at Coastline to get involved in the community, and some of the things you guys did during COVID to give back to the community. And I find that really amazing. And it's like, it makes me really proud to be a student here. So I just wanted to share that I'm grateful for this, but I'm also really grateful to all of you who put together these opportunities for students and do so much for our community.
Awesome. Yeah, I think it's really events like this that really help supplement your education, because, you know, things that you learn in the classroom is really important, but sometimes hearing perspectives for people that are doing it in the field, or admissions people, or faculty outside the classroom is as equal, sometimes even more valuable than what you could learn in the classroom. Great. Well, thank you again for those that are still here. We're gonna hang on for 5 more minutes. So if you'd like to share or have any questions for any of our faculty here, feel free to do so.